X Down syndrome. Down syndrome, also called trisomy 21, is the most common autosomal chromosomal irregularity, occurring in approximately 1:700 live births. The risk of a trisomy 21 pregnancy increases with maternal age. Most individuals with Down syndrome have full trisomy 21, which occurs due to meiotic non-disjunction and results in a genotype with 3 complete copies of chromosome 21 and a total of 47 chromosomes. Other less common forms of Down syndrome are translocation trisomy 21 and mosaic trisomy 21. Clinically, trisomy 21 manifests as a syndrome involving a characteristic appearance, example upward slanting palpebral fissures, epicanthal folds, protruding tongue, short stature, transverse palmar crease, sandal gap, organ malformations, example heart defects, duodenal atresia, Hirschsprung disease, and endocrine disorders, example obesity, diabetes mellitus, hypothyroidism. Trisomy 21 is associated with an increased risk of malignancy, example high risk of leukemia, and intellectual disability. Down syndrome is primarily detected in prenatal tests, including ultrasound measurement of nuchal translucency and maternal blood tests for certain hormones, example increased inhibin A and BHCG, decreased estriol, alpha-fetoprotein, and pregnancy-associated protein A. Fetal karyotyping via chorionic villus sampling or amniocentesis confirm the diagnosis, but these procedures are associated with an increased risk of fetal injury or loss. Management of trisomy 21 involves evaluation, monitoring, and treatment of the symptom complex and malformations as necessary. 002. Epidemiology. Most common viable autosomal chromosome aberration, 1:700 live births, and most common genetic cause of cognitive impairment F2, the risk of a Down syndrome pregnancy increases with maternal age. 3 copyright incidents at 20 years, 1:2000 copyright incidents at 30 years, 1:900 copyright incidents at 40 years, 1:100 copyright incidents at 45 years, 130. The general risk of trisomy 21 increases with maternal age. This does not, however, apply to translocation trisomies. Epidemiological data refers to the U.S., unless otherwise specified. OOCES. Etiology. Full trisomy 21, 95% of cases. Definition: 3 complete copies of chromosome 21 are present in all cells, with a total of 47 chromosomes. Occurrence: full trisomy 21 is not a hereditary disease, the chromosomal irregularity occurs spontaneously. Plus pathogenesis, meiotic non-disjunction 4. Copyright maternal non-disjunction occurs during meiosis in approximate 70% of cases and during meiosis II in approximate 20% of cases. O may occur due to paternal non-disjunction during spermatogenesis, more commonly during meiosis II, approximate 5% of cases. Karyotype, 2, 47XX plus 21 or 07, 47XY plus 21. Translocation trisomy 21, 3 to 4% of cases. Definition: 3 copies of chromosome 21 are present, one of which is attached to another chromosome, usually chromosome 14, less likely attached to chromosomes 13, 15, or 22. Occurrence, independent of maternal age, occurs as a spontaneous translocation. Pathogenesis and karyotype. Carriers of balanced Robertsonian translocation have a normal phenotype. Children of a translocation carrier can inherit a normal karyotype, balanced translocation, or unbalanced translocation, trisomy 21. Copyright in approximate 50% of cases, a balanced translocation is inherited from a parent, usually the mother, who does not show phenotypic expression of trisomy 21. 5 equals balanced Robertsonian translocation, Translocation of the long arm of chromosome 21 to the long arm of chromosome 14 equals karyogram shows a total number of 45 chromosomes and may be expressed as either $45xxt, 14, 21, or at 45xyt, 14, 21, 2. Equals affected individuals inherit a balanced translocation from their phenotypically normal parent. Equals unbalanced Robertsonian translocation, clinical features of trisomy 21 caused by inheritance of a translocation chromosome and a normal chromosome. Equals although there are only 46 chromosomes present, there are 3 copies of genetic material from chromosome 21. Equals QL. Collapse fine text outline. Equals unbalanced Robertsonian translocation, clinical features of trisomy 21 caused by inheritance of a translocation chromosome and a normal chromosome. AETEL equals although there are only 46 chromosomes present, there are 3 copies of genetic material from chromosome 21. Equals results in the karyotypes $46XX plus 21T, 14, 21, and O, 46XY plus 21T, 14, 21. Pregnancy can end in miscarriage. 1, 6. Copyright. The other cases of balanced Robertsonian translocation are caused by new translocations during meiosis. Mosaic trisomy 21, 1 to 2% of cases. Definition: 2 cell lines are present, the trisomy 21 cell line and the normal cell line. 1e pathogenesis. Copyright non-disjunction during mitosis that occurs after fertilization. Depending on the timing of the mitotic error, there is a variable proportion of trisomic and normal cells. Copyright phenotypic expression varies according to the ratio of healthy to trisomic cells. Cent karyotype, either 2, 46XX/47XX plus 21 or 07, 46XY/47XY plus 21. 6. Although symptoms may be less severe in mosaic trisomies, the clinical manifestation generally provides no indication of the underlying genetic mutation. And to remember that Down syndrome is caused by trisomy 21, think of the drinking age of 21, in the US. 7 VO. CE. Clinical features. Facial and cranial features, craniofacial dysmorphia. Eyes. O upward slanting palpebral fissures. O epicanthal folds. Copyright ocular hypertelorism, a distance between the eyes greater than the 95th percentile. O brushfield spots, an aggregation of connective tissue in the periphery of the iris, visible as white or grayish-brown spots. O refractive errors, example myopia, astigmatism, copyright strabismus. Copyright cataracts, congenital, infantile, or juvenile. 7. Mouth. O a small oral cavity together with a large and furrowed tongue results in the appearance of a protruding tongue. Copyright high arched and narrow palate. 8. Copyright teeth, late development, small size with short roots, large gaps between teeth. Scent. Further features. O brachycephaly. O hypoplastic nasal bones, broad and flat nasal bridge. Copyright ear anomalies, small, round, low-set ears, adherent earlobes. Copyright short neck, excess skin at the nape of the neck, may be seen on prenatal ultrasound. Extremities, soft tissue, and skeletal features. Scent. Extremities. O transverse palmar crease, single crease that runs across the palm, along the metacarpophalangeal joints perpendicular to the fingers. EEA9. Copyright sandal gap, a medial displacement of the first toe leading to a large space between the first and second toes. M9. Copyright clinodactyly, abnormal curvature of a finger, typically refers to inward curvature of the fifth finger. Cocamptodactyly equals a congenital, fixed digital flexion deformity most often seen in the fifth digit. Equals associated with several congenital syndromes, including Down syndrome. Brachydactyly. Scent. Soft tissue. Copyright connective tissue deficiency. T. Risk of umbilical and inguinal hernias. O marked hyperextension of joints. Equals al. Collapse fine text outline. Scent. Obesity, Prevalence is approximate 50%, higher than in the general population. AF and scent skeletal features O atlantoaxial instability O short stature equals reduced growth with shortening of long bones average adult height, 150 centimeters, 4 feet 11 in, 3, 2I. Organ malformations and associated conditions. Plus heart, congenital heart defects in 50% of cases, 3 copyright atrioventricular septal defect, endocardial cushion defect, is the most common heart defect in individuals with Down syndrome. Copyright ventricular septal defect degree atrial septal defects copyright tetralogy of Fallot O patent ductus arteriosus sent gastrointestinal tract copyright duodenal atresia / stenosis O annular pancreas copyright anal atresia copyright megacolon copyright rectal prolapse E Hirschsprung disease sent urogenital system O hypogonadism copyright cryptorchidism copyright decreased fertility in men sent further features. Degree hypothyroidism type 1 diabetes celiac disease obstructive sleep apnea hearing loss due to recurrent otitis media increased risk of leukemia, acute lymphoblastic leukemia, acute myeloid leukemia, early onset Alzheimer disease, the amyloid precursor protein, which generates amyloid beta, is located on chromosome 21. Increased risk of developing epilepsy. Degree development. Scent motor skills copyright delayed motor development O muscle hypotonia scent intelligence O varying levels of intellectual disability, average 1Q, 50, 41 copyright apparent within the first 12 months, developmental milestones, example sitting, walking, talking, are achieved at approximately twice the age of children without Down syndrome. 15. Scent behavioral and psychiatric disorders copyright behavioral disorders ADHD equals conduct disorder. Degree autism spectrum disorder. 6. Down syndrome is the most common genetic cause of intellectual disability. QB to remember the most important features associated with Down syndrome, think of the 5 A's, advanced maternal age, duodenal atresia, atrioventricular septal defect, AML/ALL, early onset of Alzheimer disease. AO. OE. Diagnostics. Diagnostic approach. Diagnosis of Down syndrome is primarily prenatal and the diagnostic approach is dependent on the week of gestation. Al. Collapse fine text outline. Diagnostic approach. Scent diagnosis of Down syndrome is primarily prenatal and the diagnostic approach is dependent on the week of gestation. Initial screening test copyright standard tests first trimester combined test, 11 to 13 weeks, equals second trimester quadruple test, 15 to 18 weeks, copyright additional tests, usually performed optionally in high-risk pregnancies, example maternal age 35 years, history of prior pregnancy with trisomy, ultrasound features suggesting aneuploidy, 61L17 equals integrated tests over the first and second trimesters equals cell-free DNA, 10 to 20 weeks, sent if any of the above screening tests yield an abnormal result. One of the following confirmatory diagnostic tests is performed, amniocentesis, 15 to 22 weeks, copyright chorionic villus sampling, 9 to 14 weeks, percutaneous umbilical cord sampling, 18 to 22 weeks, see prenatal diagnostics. Prenatal screening. Counseling. Precedes screening procedures provides information that screening is voluntary explains the option of terminating the pregnancy if trisomy 21 is diagnosed. Screening procedures. Plus indication, recommended for all women prior to the 20-week of gestation scent combined test, first trimester, 11 to 13 weeks, O has a 90% detection rate, 18O maternal serum 1 beta human chorionic gonadotropin, BHCG, equals pregnancy-associated plasma protein A, PAP-A, O ultrasound nuchal translucency measurement, nuchal translucency increases due to the large amount of fluid collecting behind the neck, DS is equals short neck, thickened nuchal fold equals absent or hypoplastic nasal. Bone equals shortened middle phalanges of the fifth digits with clinodactyly equals shortened long bones, humerus, femur, asterisk quadruple test, second trimester, 15 to 18 weeks, O-free estriol O-alpha-fetoprotein, AFP, OT inhibin A OT-BHCG. Additional screening tests. The following tests are optional and performed in addition to the above-mentioned tests, and they are evaluated along with the results of the second trimester quadruple test. Copyright sequential integrated test combines the results from the first trimester combined test and second trimester quadruple test. Copyright cell-free fetal DNA. 10 to 20 weeks fetal DNA is isolated from a maternal blood specimen and evaluated for chromosomal abnormalities. 20 equals non-invasive for the fetus, but expensive test equals more predictive in women with a high risk equals the test is currently available but not guideline recommended. And in the quadruple test, HCG and inhibin A are both high up, 1, and estriol and A-fetoprotein are both deficient, 1. Fetal karyotyping, confirmatory test. Scent indications. Copyright positive screening test. Copyright previous trisomy 21 pregnancy parent with known chromosomal translocation or aberration plus procedures. 21. Copyright chorionic villus sampling, 9 to 14 weeks, amniocentesis, 15 to 22 weeks, copyright percutaneous umbilical cord sampling, 18 to 22 weeks, 221 cent complications V equals EYL. Collapse fine text outline. Down syndrome. Fetal karyotyping, confirmatory test. Scent indications. Copyright positive screening test. O previous trisomy 21 pregnancy parent with known chromosomal translocation or aberration plus procedures. 21. Copyright chorionic villus sampling, 9 to 14 weeks, O amniocentesis, 15 to 22 weeks, copyright percutaneous umbilical cord sampling, 18 to 22 weeks, 22. Scent complications. Copyright bleeding. Copyright infection. O fetal injury. OE amniocentesis has a lower risk of fetal loss compared to chorionic villus sampling. Postnatal diagnostics. Chromosome analysis screening for associated conditions. See clinical features, example echocardiography to detect heart defects. QB typical features and malformations are important indicators but diagnostic confirmation is still required. OI. OE. Differential diagnoses. Isolated hypotonia. Zellweger syndrome. Congenital hypothyroidism. Trisomy 13. Trisomy 18. Williams syndrome. Turner syndrome. The differential diagnoses listed here are not exhaustive. ZAO. Treatment. Evaluation, monitoring, and treatment of the symptom complex and malformations as necessary, example cardiac screening with an echocardiogram and heart surgery for cardiac malformations, early, targeted intervention, educational programs, and support. Copyright physical therapy. Behavioral therapy. O speech therapy. Copyright occupational therapy. WY. OE. Prognosis. Decreased life expectancy with an average lifespan of approximate 60 years. 23 common causes of death in individuals with Down syndrome, in decreasing order of incidence, 241-25 copyright infections, particularly pneumonia. Congenital malformations, particularly congenital heart diseases. Copyright circulatory diseases, example coronary artery disease, O dementia. Equals A. Collapse fine text. O. Outline. Euro Down syndrome, 1/1. Down syndrome. Epidemiology incidence, 1:700 live births. Etiology 3 complete copies of chromosome 21, due to meiotic non-disjunction in 95% of cases. Karyotype Q47XX plus 21-3, 47XY plus 21. Complications due to organ malformations and immunodeficiency. Increased risk of AML/ALL. Early onset Alzheimer's disease. Important risk increases with maternal age. Life expectancy 50 years. Down syndrome fact sheet. Copyright Emboss. Short stature. Hearing loss, recurrent asterisk otitis media backslash hypothyroidism underscore asterisk. Cardiac malformations, example ASD, VSD, /NS. Gastrointestinal malformations, example duodenal atresias stenosis, annular pancreas. Urogenital malformations FL, e.g. hypogonadism, J/PE low fertility in men. Sandal gap //. Intellectual disability. Brushfield spots. In /I/ill. SQ single transverse IES palmar crease, I, clinodactyly, IL, brachydactyly, 2, camptodactyly, 4. Umbilical and inguinal hernias. Delayed motor development, hypotonia. Karyogram in full trisomy 21 VV. The karyogram for karyotype 47XY plus 21 shows 3 complete copies of chromosome 21 and a total of 47 chromosomes. Source, copyright IMPP. And Down syndrome, 1/5. DNA replication. Meiosis VAX. Y//meiosis 2EEN//. Trisomy monosomy trisomy normal. Meiotic non-disjunction VV. A numeric chromosome aberration, i.e., a differing number of chromosomes, can occur through an incorrect distribution of chromosomes during meiosis. The homologous chromosome pairs usually separate during the reduction division, meiosis, while the homologous sister chromatids do so during the equational division, meiosis II. The occurrence of non-disjunction during one of these two steps leads to the development of aneuploid gametes, in which the chromosome is either duplicated, 24 chromosomes in total, or missing, only 22 chromosomes in total. This results in trisomy, example trisomy 21, or monosomy, example Turner syndrome. Copyright Emboss. i.e. Down syndrome, 3/5. Equals. __A, balanced set of acrocentric breakage and, chromosomes rejoining Robertsonian translocation, RT. Robertsonian translocation 1 VV. Copyright Emboss. Euro Down syndrome, 4/5. Karyogram in balanced Robertsonian translocation, 14/21. The karyogram for karyotype 45XXT, 14/21, shows the translocation of the long arm of chromosome 21 to the long arm of chromosome 14 with the elimination of the respective short arms and fusion of the chromosomes. Source, copyright IMPP. Down syndrome, 5/5, balanced RT normal, carrier, chromosomes. 14, root 21 14/21Y unbalanced RT, trisomy 21, A. 2 at registered at 14/21. Robertsonian translocation 2 VV copyright Emboss. X chromosomal aberrations. Structural and numerical chromosomal aberrations may affect either the autosomes or gonosomes and are a common cause of spontaneous abortions. Autosomal aberrations that are frequently observed are trisomy 13, Patau syndrome, trisomy 18, Edwards syndrome, and the most common and widely recognized chromosomal aberration, trisomy 21, Down syndrome. These conditions have an extra copy of the chromosome to which their name refer. The risk of autosomal aberrations increases with maternal age. Characteristic features include facial and skeletal malformations, which are usually recognizable at birth. The conditions are further associated with congenital heart defects and malformations of other internal organs. Turner syndrome and Klinefelter syndrome are gonosomal aberrations in which individuals have a missing X chromosome or an additional X chromosome, respectively. These conditions are primarily characterized by impaired development of secondary sexual characteristics and infertility secondary to gonadal dysgenesis. The diagnosis for all chromosomal aberrations is confirmed via karyotyping. W.A. Re. I.O. Overview. Definitions. Scent chromosomal aberrations, deviation from the normal chromosome constellation. O numerical chromosomal aberrations, example aneuploidy, polyploidy, copyright structural chromosomal aberrations, example deletion, translocation. Scent triploidy, presence of 3 sets of chromosomes. Scent trisomy, presence of triplicate instead of a duplicate number of a particular chromosome or part of a chromosome. Epidemiology. Chromosomal aberrations are the most common cause of spontaneous abortions, accounting for 60% of cases. Approximate 50% of anomalies are trisomies. Approximate 20% of anomalies are triploidies. Viable numerical chromosomal aberrations. Autosomal chromosomal aberrations. Trisomy 13, Patau syndrome. Copyright 2, 47XX413 karyotype. Copyright Platzi 413. Meiotic non-disjunction equals pathogenesis midline defects. Asterisk cleft lip and palate low set, malformed ears clinical FMI asterisk polydactyly rocker bottom feet. Coloboma 0. Aplasia cutis congenita asterisk. PDA, associated conditions asterisk omphalocele polycystic kidney disease capillary hemangioma. Neurocognitive deficiency severe intellectual disability. Life expectancy cent. Back. Abnormal fusion of precordial mesoderm. Congenital heart defects, particularly VSD. Overview of autosomal chromosomal aberrations. Trisomy 18, Edwards syndrome. 2, 47XX418 and A7XY plus 18. Meiotic non-disjunction. Low set ears micrognathia prominent occiput clenched fists with flexion contract ears and overlapping fingers rocker bottom feet. Congenital heart defects, particularly VSD, ASD, tetralogy of Fallot, myelomeningocele omphalocele diaphragmatic hernia horseshoe kidneys. Equals a collapse. Trisomy 21, Down syndrome. Full trisomy, meiotic non-disjunction MOQA7XX421 OPI A7.XY421. Translocation trisomy 21 copyright balanced Robertsonian translocation equals 2, 45XXT, 14, 21, equals 3, 45XYT, 14, 21. Copyright unbalanced Robertsonian translocation equals 2, 46XX plus 21T, 14, 21, equals A6XY plus 21T, 14, 21. Mosaic trisomy 21, non-disjunction during mitosis that occurs after fertilization. Degree percent, 46XX/47XX plus 21 copyright 00, 46XY/47XY plus 21. Plus upward slanting palpebral phi, epicanthal fold scent brushfield spot scent large, furrowed, protruding tongue asterisk brachycephaly hypoplastic nasal bones, broad and flat nasal bridge * short neck with extranuchal folds * transverse palmar crease * sandal gap * clinodactyly * obesity general hypotonia short stature. Congenital heart defects, particularly AVSD, VSD, ASD, tetralogy of Fallot, duodenal atresia, annular pancreas, anal atresia, Hirschsprung disease hypothyroidism, type 1 diabetes increased risk of leukemia, AML, all, early onset Alzheimer disease atlantoaxial instability. Variable, average IQ, 50. Decreased, 60 years. AO. Fine text outline. SAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAAA syndrome cent Turner syndrome cent 47XYY syndrome cent 47XXX syndrome. WA CE Trisomy 13, Patau syndrome. Karyotype copyright $47XX4 plus 13 degree and A47XY plus 13 plus incidence 1:7,400 live births 1 cent pathogenesis copyright meiotic non-disjunction copyright abnormal fusion of precordial mesoderm midline defects cent clinical features degree MICR det air, OE HAL, BAS JPP copyright characteristic facial anomalies equals cleft lip and palate equals low set, malformed ears equals bulbous nose equals small chin microphthalmia, small orbits, which may be unilateral or bilateral, possibly coloboma, ocular hypotelorism copyright. Polydactyly, primarily hexadactyly, flexed fingers copyright congenital heart defects, particularly ventricular septal defect, patent ductus arteriosus, o rocker bottom feet o aplasia cutis congenita, congenital absence of skin, most commonly scalp lesions with a punched-out appearance that may extend to the bone or the dura ao omphalocele copyright visceral and genital anomalies, especially of the kidneys and ureters, example polycystic kidney disease, copyright capillary hemangioma cent diagnostics. Copyright usually detected during first trimester screening with combined ultrasound and maternal serum testing, for PAPE, T nuchal translucency. OC prenatal diagnostics. Cent prognosis, infants usually die before the age of 1, only approximate 11% of infants survive past 12 months of age. 2. And B. The age of puberty onset is 13, Patau syndrome is caused by trisomy 13. And 7 PS of Patau syndrome, holoprosencephaly, cleft lip and palate, polydactyly, pump disease, congenital heart disease, polycystic kidney disease, cutis aplasia. OE. Trisomy 18, Edwards syndrome. Cent karyotype $47XX plus 18 OA, 47XY for 18 cent incidence copyright 1:3,300 live births O after trisomy 21. Trisomy 18 is the most common autosomal trisomy in which fetuses can survive to birth. Plus pathogenesis, meiotic non-disjunction cent gender, 2 greater than 7 cent clinical features AE characteristic facial anomalies low set ears, malformed auricle, micrognathia, congenital mandibular hypoplasia. Back collapse fine text outline. Cent clinical features copyright 7 copyright characteristic facial anomalies equals low set ears, malformed auricle, micrognathia, congenital mandibular hypoplasia, equals prominent occiput equals microcephaly equals broad nose equals cleft lip and palate, high palate copyright clenched fists with flexion contract ears and overlapping fingers, 1 copyright rocker bottom feet, convex deformity of the plantar side of the foot, with a vertical talus, and prominent calcaneus 1O congenital heart defects, particularly VSD, ASD. Tetralogy of Fallot, copyright malformations of internal organs, diaphragmatic hernia, ureter and kidneys, horseshoe kidneys, O myelommeningocele e omphaloceele O severe intellectual disability sent diagnosis degree quadruple test in the second trimester shows free estriol, AFR, BHCG, and normal/inhibin AOC prenatal diagnostics. Sent prognosis, only approximate 13% of patients survive past 12 months of age. 2. P. Copyright. Prince Edward turned 18, prominent occiput, rocker bottom feet, intellectual disability, non-disjunction, in meiosis, clenched fists, low set ears, and chromosome 18. 7. See at shared knot. Down syndrome, trisomy 21. See article on Down syndrome. A. WA. And shared no. 47XYY syndrome and 47XXX syndrome. Sent karyotype 00, A7XYY09, 47XXX plus incidence 1/4I copyright 47XYY syndrome, 1/1,000 male newborns copyright 47XXX syndrome, 1/1,000 female newborns sent clinical features 047XYY syndrome. 5, equals tall stature equals sometimes severe acne equals mild delays in motor and language development equals possible fertility problems, decreased sperm count. 047XXX syndrome. 6, equals tall stature equals delayed motor and language development equals learning disabilities equals menstrual abnormalities, occasionally fertility problems plus diagnosis 71 copyright the majority of XXX women or YY men are never diagnosed. O chromosome analysis. Back collapse fine text outline. Sent diagnosis copyright quadruple test in the second trimester shows free estriol, AFP, BHCG, and normal/J inhibin AOC prenatal diagnostics. Prognosis, only approximate 13% of patients survive past 12 months of age. 2. Equals %. Prince Edward turned 18, prominent occiput, rocker bottom feet, intellectual disability, non-disjunction, in meiosis, clenched fists, low set ears, and chromosome 18. Degree Ru. Down syndrome, trisomy 21. See article on Down syndrome. AEMN. O. EE shared notes manage. 47XYY syndrome and 47XXX syndrome. Sent karyotype 00, A7XYYOG 47XXX incidence/IL4L. Copyright 47XYY syndrome, 1/1,000 male newborns copyright 47XXX syndrome, 1/1,000 female newborns sent clinical features. 047XYY syndrome. 5, tall stature, equals sometimes severe acne equals mild delays in motor and language development equals possible fertility problems, decreased sperm count. 047XXX syndrome. 6 equals tall stature equals delayed motor and language development equals learning disabilities equals menstrual abnormalities, occasionally fertility problems sent diagnosis V70 the majority of XXX women or YY men are never diagnosed. O chromosome analysis sent treatment copyright only symptomatic treatment is possible. Copyright speech therapy copyright physical, occupational, and educational therapy a reproductive specialist in case of fertility problems. A 2 hair YNSH. Sources. Last updated August 15, 2022. Back collapse fine text outline. And chromosomal aberrations, 1/5. DNA replication. Meiosis VAX. Y//meiosis 2EEN//. Trisomy monosomy trisomy normal. Meiotic non-disjunction VV a numeric chromosome aberration, i.e., a differing number of chromosomes, can occur through an incorrect distribution of chromosomes during meiosis. The homologous chromosome pairs usually separate during the reduction division, meiosis, while the homologous sister chromatids do so during the equational division, meiosis II. The occurrence of non-disjunction during one of these two steps leads to the development of aneuploid gametes, in which the chromosome is either duplicated, 24 chromosomes in total, or missing, only 22 chromosomes in total. This results in trisomy, example trisomy 21, or monosomy, example Turner syndrome. Copyright emboss. Chromosomal aberrations, 2/5. Coloboma of the iris VV. Slit lamp photography of the right eye. The pupil shows a characteristic keyhole shape due to an inferior opening in the iris, coloboma. Colobomas may be congenital, due to incomplete closure of the embryonic fissure, or acquired, example from trauma or surgery. Depending on the location and extent of a coloboma, it may be asymptomatic or lead to visual impairment, example increased light sensitivity, diplopia. Source, Coloboma of the Iris by J. Marchn, Wikimedia Commons, licensed under CC by SA 3.0. Chromosomal aberrations, 3/5. Aplasia cutis congenita. An erythematous, circular, and well-demarcated lesion can be seen on the patient's scalp. The absence of skin and hair on this lesion is notable and consistent with aplasia cutis congenita. Source, A Practical Approach to the Diagnosis and Management of Hair Loss in Children and Adolescents by Lewin Su, Kevin X. Liu and Marianne M. Senna, Frontiers in Medicine, licensed under CC by 4.0. Chromosomal aberrations, 4/5. Overlay. Capillary hemangioma of the skin, cherry angioma, VV. Photomicrograph of skin tissue, H&E stain, high magnification, many widely dilated capillaries, examples outlined in black, filled with numerous erythrocytes, green overlay, can be seen. They can be distinguished from veins, arteries, and arterioles by their wall structure, which has no subdivision into intima, media, and adventitia, and is formed mainly by a thin endothelium, black arrowheads. Collagenous connective tissue can be seen between the dilated capillaries. Click on the microscope icon to view the entire specimen through a virtual microscope. Source, copyright Smart Zoom, Smart in Media. Image and annotations in digital microscopy, PD Dr. Alberto Perez Buza. Urochromosomal aberrations, 5/5. Characteristic facies Patau syndrome, trisomy 13, G. Microcephaly / epidemiology J, incidence, 1:7,400 live births SSOO. Etiology AIE free trisomy 13, 75%. Microphthalmia, ear E trisomy 13 with coloboma equals malformations Robertsonian translocation, 20%. Cleft lip N/A/ or palate E, microgenia karyotype Q, 47, XX, plus 13I4. 3, 47, XY, plus 13E. Prognosis median survival if live-born, 5 days OSOE 1 year survival probability, 11% 8 equals. Degree urogenital LT by, cardiac defects node malformations, VSD, example polycystic correlation with maternal age in free kidney disease, J trisomy 13/. QQ, 4 co-XQ/J severe mental and motor impairment / single transverse X. Capillary palmar crease, / hemangiomas polydactyly. Patau syndrome, trisomy 13, fact sheet VV. Copyright emboss. And chromosomal aberrations, 1/2. DNA replication. Meiosis VAX. Y / meiosis 2 EEN /. Trisomy monosomy trisomy normal. Meiotic non-disjunction via numeric chromosome aberration, i.e., a differing number of chromosomes, can occur through an incorrect distribution of chromosomes during meiosis. The homologous chromosome pairs usually separate during the reduction division, meiosis, while the homologous sister chromatids do so during the equational division, meiosis II. The occurrence of non-disjunction during one of these two steps leads to the development of aneuploid gametes, in which the chromosome is either duplicated, 24 chromosomes in total, or missing, only 22 chromosomes in total. This results in trisomy, example trisomy 21, or monosomy, example Turner syndrome. Copyright emboss. Eurochromosomal aberrations, 2 halves. Edwards syndrome, clenched fists with ooflexion, contract years, epidemiology and overlapping fingers, incidence 1:6.000 QD. Etiology, presence of an extra chromosome 18, broad nose, cleft lip, Kevin and palate, high palate. 2. 47XX plus 18, 347XY plus 18, congenital heart defects, example VSD, ASD. Life expectancy only 5 to 10% survive Y. Past 12 months of age Y. Rocker bottom feet _ plus. Edwards syndrome fact sheet. Copyright emboss. Important S. Second most common trisomy tetralogy of Fallot. After Down syndrome, trisomy 21, risk increases with maternal age. Copyright, diaphragmatic hernia / microcephaly, prominent occiput, low set ears, malformed auricles, micronathia. Malformation of ureters and kidneys, horseshoe kidneys. Quadruple test, E-free estriol EAFPE inhibin AE beta HCG. Down syndrome. Epidemiology, incidence 1:700 live births. Etiology, 3 complete copies of chromosome 21, due to meiotic non-disjunction in 95% of cases. Karyotype Q47XX plus 21:3, 47XY plus 21. Complications due to organ malformations and immunodeficiency. Increased risk of AML/ALL. Early onset Alzheimer's disease. Important risk increases with maternal age. Life expectancy 50 years. Down syndrome fact sheet. Copyright emboss. Short stature. Hearing loss, recurrent otitis media / hypothyroidism _*. Cardiac malformations, example ASD, VSD/NS. Gastrointestinal malformations, example duodenal atresias / stenosis, annular pancreas. Urogenital malformations FL, e.g. hypogonadism, J/PE, low fertility in men. Sandal gap //. Intellectual disability. Brushfield spots. In /I/ill. SQ single transverse IES palmar crease, I, clinodactyly, IL, brachydactyly, 2, camptodactyly, 4. Umbilical and inguinal hernias. Delayed motor development, hypotonia. Rare inherited syndromes. This card provides an overview of inherited symptom complexes that occur rarely in the general population. These syndromes are caused by inherited genetic defects, which occur either due to chromosomal aberrations or autosomal / sex-linked traits. The presentation differs for each syndrome, with most features arising from developmental, functional, or structural anomalies of various organs. The diagnosis can be confirmed with the help of molecular genetic detection, fluorescence in situ hybridization, FISH, or other genetic / chromosomal studies. Treatment is usually symptomatic. O. And Prader-Willi syndrome and Angelman syndrome. Overview. Plus definition, genetic syndromes caused by microdeletion, at 15q11q13, in combination with genomic imprinting. Plus etiology, the resulting condition depends on the affected gene copy. 1 OE Angelman syndrome * deletion or mutation of maternal UBE3A, chromosome 15, gene copy and paternal gene methylation, silencing, CA equals in 5% of cases, it results from paternal uniparental disomy, i.e. both copies of chromosome 15 are inherited from the father. Copyright Prader-Willi syndrome deletion or mutation of paternal gene copy and maternal gene methylation, silencing, caused by maternal uniparental disomy in about 20 to 35% of cases. LL-CENT diagnosis, genetic tests. O fluorescence in situ hybridization, FISH, O methylation testing. QB Prader misses his papa, and Angel her mama, allele mutation/deletion of paternal origin in Prader-Willi syndrome and maternal in Angelman syndrome. Prader-Willi syndrome I/4IL5. CENT clinical features. Degree muscular hypotonia, and poor feeding in infants, increased appetite, hyperphagia, and obesity, short stature. Copyright, scoliosis, cryptorchidism, hypogonadism - genital hypoplasia, facial dysmorphia, example almond-shaped eyes, thin upper lip, premature Adrian Archie with early development of pubic/axillary hair, developmental delays, example delayed achievement of milestones, intellectual disability, behavioral problems, example temper tantrums, stubbornness, obsessive compulsive behavior. Degree CENT treatment. Copyright calorie restriction, copyright substitution of growth hormone and sex hormone. CENT complications. Copyright sleep apnea, most common, copyright type 2 diabetes mellitus, copyright choking episodes, copyright gastric distension and rupture. CENT prognosis, normal life expectancy if extreme obesity is avoided. O delayed mental development and acquisition of motor skills in infants and young children, absent speech development. Copyright intellectual disability. O in more than 80% of cases, pronounced epileptic seizures. Copyright microcephaly v. Back collapse. Fine text outline. ESSS. Copyright ataxia, tremulous movements of the limbs. Copyright truncal hypotonia, limb hypertonia, hyperreflexia. Copyright difficulty sleeping. Copyright characteristic happy demeanor with frequent laughing, inappropriate laughter. O hyperexcitability, short attention span. Copyright fascination with water. CENT treatment. Copyright no specific treatment. Copyright physical, occupational, and speech therapy. Copyright anti-epileptic drugs, if applicable. CENT prognosis, life expectancy is typically normal. At angels in the heavens, happy-go-lucky, easily excitable personality, ataxia, verbal underdevelopment, epileptic seizures, abnormal facial features, severe intellectual disability. ZO. OOBOD. Fragile X syndrome. CENT definition, an X-linked dominant disease caused by a CGG-trin ion GJE repeat expansion in the FMR1 gene, Fragile X mental retardation 1 gene, during oogenesis. This leads to its hypermethylation, which silences the gene and renders it unable to express its physiological gene product. OPM allo-CENT epidemiology. Copyright second most common genetic cause of intellectual disability, after trisomy 21, copyright most common inherited cause of intellectual disability, as trisomy 21 mostly occurs sporadically. Copyright sex distribution at 4 CENT clinical features. The clinical presentation varies depending on the number of trinucleotide repeats. E50 to 200 repeats, premutation ataxia, primary ovarian insufficiency, tremor. Copyright 200 repeats, full mutation intellectual disability of varying severity, delayed language development, behavioral features, autistic behavior, hyperactivity, anxiety characteristic facial anomalies equals long and narrow face equals prominent forehead and jaw equals large everted ears. Hypermobile joints in men, postpubertal macroorchidism, enlarged testes, rarely occurs prior to puberty, mitral valve prolapse, can lead to mitral regurgitation above average head circumference focal seizures scent diagnosis copyright molecular genetic detection, PCR, southern blot, copyright cytogenetic detection, not very sensitive, copyright echocardiography 1 cent treatment, symptomatic scent prognosis, generally normal life expectancy. And fragile extra large ears, testes, and face in these patients. CE. Rett syndrome. Asterisk definition, X-linked disorder with progressive loss of intelligence and cognitive abilities such as language, locomotion, and fine motor skills 19v. Back collapse fine text outline. X rare inherited syndromes. Rett syndrome. Scent definition, X-linked disorder with progressive loss of intelligence and cognitive abilities such as language, locomotion, and fine motor skills 10 cent etiology, X-linked dominant gene mutation in methyl CpG binding protein 2 gene, MECP2 gene. Usually not an inherited gene defect, but rather a sporadic mutation. Copyright mutation usually occurs in the paternal allele, thus, females are almost exclusively affected. 1 copyright if affected, male fetuses die in utero or shortly after birth. Scent clinical features copyright normal development until the first symptoms appear, which typically happens at 6 to 18 months of age. Symptoms of neurodevelopmental regression, including loss of motor skills, especially targeted hand movements. Affected children show characteristic hand wringing, truncal ataxia, apraxia, choreatic movements, intellectual and verbal disability, seizures, growth failure, scoliosis, hyperventilation, microcephaly. Scent diagnosis, a combination of typical clinical presentation and gene mutation detection. Scent prognosis, there is not enough data regarding life expectancy beyond the age of 40, as long-term studies are not available and the disease is fairly rare. And Rett regresses, normal development is shortly followed by a loss of targeted hand movements and intellectual and verbal disability. 7a. Cri du chat syndrome, cat cry syndrome. Asterisk definition, rare syndrome caused by a chromosome 5 aberration 9, 11L12 cent epidemiology, sex distribution, 2 at, 2:1, cent etiology, microdeletion of the short arm at chromosome 5, 46XX5p or 46XY, 5p, cent clinical features copyright cat-like, high-pitched crying in affected infants copyright congenital heart defects, example VSD microcephaly copyright intellectual disability, moderate to severe, single palmar crease dysmorphic facial features equals moon facies equals widely spaced eyes equals epicanthal folds equals broad nasal bridge equals downward slanting palpebral fissures copyright skeletal abnormalities scent treatment symptomatic treatment copyright early psychological and physical assistance scent prognosis, a normal life expectancy is possible, but depends on the accompanying symptoms and therapeutic assistance. RGZ1P, OO. Williams syndrome V equals QAL. Collapse fine text outline. Williams syndrome. Plus definition, a multi-system developmental disorder caused by a deletion at chromosome 7 etiology, microdeletion of the long arm of chromosome 7, includes a deletion of the elastin gene, scent clinical features intellectual disability hypersociability, example comfort with strangers, good verbal skills copyright characteristic facial features, elfin facies equals midfacial hypoplasia, equals short palpebral fissure equals wide forehead equals flattened nasal bridge, antivert nostrils equals long philtrum equals hypodontia copyright cardiovascular malformations, especially supravalvular aortic stenosis, renal artery stenosis, hypercalcemia, due to increased sensitivity to vitamin D, low muscle tone hyperacusis, phonophobia o potential malformations and development problems in multiple organ systems, such as starburst-like pattern in the iris, stellate iris, scent diagnosis, a combination of typical clinical presentation and gene mutation detection. Y equals copyright 27 cent, P registered. B. William takes ICA cream from strangers, intellectual disabilities, cardiovascular malformations, elfin-like facial features, comfort with strangers. Go. CE. Zellweger syndrome, cerebrohepatorenal syndrome. Asterisk definition, an autosomal recessive defect in the PEX gene that results in impaired peroxisome synthesis, LL14 cent clinical features copyright characterized by presentation in the neonatal period with neonatal seizures and hypotonia o malformation of the face and head dash. O hepatomegaly o prolonged jaundice and feeding difficulties copyright polycystic kidney disease, PKD, copyright retinal dystrophy and sensorineural hearing loss scent diagnosis, increased concentration of very long-chain fatty acids in the blood scent treatment copyright currently, there is no cure for Zellweger syndrome available. O supportive management, including, placement of a feeding tube consulting specialists to treat individual problems, example audiologists, ophthalmologists, orthopedists, scent prognosis, death within 1 year of birth. WI OOSECS Pierre-Robin sequence, Pierre-Robin syndrome. Plus definition, a set of abnormalities causing fetal oral and maxillofacial malformations, scent clinical features copyright cleft palate copyright glossoptosis, retraction of the tongue in the pharynx, with possible complications such as acute respiratory distress and aspiration o mandibular retrognathia, posterior mandibular positioning, or micrognathia, small lower jaw, copyright possible intellectual disability. Registered. Scent diagnosis, fluorescence in situ hybridization, FISH, scent treatment copyright if moderate dyspnea, symptomatic treatment non-invasive ventilation supervision and assistance while eating copyright if severe dyspnea, surgical correction equals AL. Collapse fine text outline. O if severe dyspnea, surgical correction equals special interventions for long-term correction, example mandibular distraction to position the tongue closer to the front of the mouth, equals in cases of acute life-threatening respiratory distress tracheostomy. 7 OE Rubinstein-Taybi syndrome. Scent definition, inherited syndrome with characteristic facial dysmorphia etiology, CREB gene mutation, scent clinical features copyright typical facial shape, highly arched eyebrows, beaked nose with hypoplastic wing of the nose copyright during infancy, hairy forehead copyright short stature o broad thumbs and toes copyright intellectual disability scent prognosis o usually poor copyright infants born with this disorder usually survive only to early childhood references. 7. OI CE Smith-Lemli-Opitz syndrome. Asterisk definition, autosomal recessive disease with cholesterol shortage due to deficient 7-dehydrocholesterol reductase, 81L19E etiology, gene mutation of DHCR7, 7-dehydrocholesterol reductase, at chromosome 11 scent clinical features, symptoms may vary widely. E short stature o dysmorphic facial features, ptosis, epicanthal folds, microcephaly, micrognathia, copyright intellectual disability copyright internal organs malformations, genitals, kidneys, heart, copyright tosyndactyly copyright single palmar crease o seizures asterisk diagnosis, T7-dehydrocholesterol, cholesterol degree treatment, cholesterol substitution 1. OO. Yes. Albright hereditary osteodystrophy, Martin-Albright syndrome. Scent definition, a constellation of physical findings that occur in patients with pseudohypoparathyroidism type 1A and pseudohypoparathyroidism E mode of inheritance, usually autosomal dominant scent clinical features O short stature, round face, as well as metacarpal and metatarsal shortening, shortened fourth and fifth digits, intellectual disability, oligophrenia, copyright. Additionally, signs of hypoparathyroidism, hypocalcemia, tetany, cerebral seizures, intracranial calcifications, and tooth anomalies. Laboratory findings: pseudohypoparathyroidism type 1A, TPTH, J-calcitriol, calcium, TT phosphate. Pseudohypoparathyroidism, normal PTH, calcitriol, calcium, and phosphate. LL. OFOS. Noonan syndrome. Scent definition: autosomal dominant condition with a heterogeneous clinical picture due to mutation in the PTPN11 gene on chromosome 1220. Scent epidemiology: 1:1000-2500 live birth. Scent clinical features: proportionate short stature, often developing only after birth, minor facial dysmorphism, including ocular hypertelorism, a distance between the eyes that is greater than the 95th percentile, and downslanting eyes, webbed equals QL. Collapse. Fine text outline. Scent clinical features: copyright proportionate short stature, often developing only after birth, copyright minor facial dysmorphism, including ocular hypertelorism, a distance between the eyes that is greater than the 95th percentile, and downslanting eyes, webbed neck. Heart disease, including pulmonary valve stenosis. Copyright intellectual development may be delayed, but by adulthood intelligence is normal in %% of patients. Scent differential diagnoses: Bardet-Biedl syndrome, a rare monogenic hereditary disease characterized by short stature, obesity, retinitis pigmentosa, intellectual disability, and polydactyly. Weill-Marchesani syndrome, a rare hereditary disorder characterized by dwarfism, heart defects, and eye conditions, lenticanus, ectopia lentis, and secondary glaucoma. 7*2. Silver-Russell syndrome. Scent definition: rare, sporadic syndrome associated with intrauterine growth retardation. Scent clinical features: OJ infant length, relative macrocephaly, copyright dysmorphic facial features, asymmetric triangular face with a high forehead and drooping labial commisures, copyright clinodactyly, crooked finger, normal or mildly impaired cognitive development. EO. Fay, Co. Treacher-Collins syndrome. Scent definition: an autosomal dominant condition characterized by craniofacial abnormalities and external ear deformities resulting from impaired migration of neural crest cells into the first and second bronchial arches. 21. Scent etiology, most commonly results from the mutations of TCOF1 gene on chromosome 5 or POLR1D gene on chromosome 5. Scent clinical features: copyright micrognathia and retrognathia, difficulties with feeding and respiration. Hypoplasia of the zygomatic arch, downward slant of the eyes. External ear and auditory canal abnormalities, conductive hearing loss. Copyright coloboma of the lower lid. Scent management: respiratory support if needed. Copyright craniofacial reconstruction surgery. Copyright hearing aids. Copyright speech therapy. Pulmonary alveolar proteinosis, PAP. Overview of PY is 221,123 primary PAP characteristics, secondary PAP, congenital PAP, autoimmune PAP, hereditary PAP. Definition: syndromes characterized by the progressive accumulation of surfactant protein in the alveoli. 90% of all PAP cases. II prevalence 67:1,000,000. Epidemiology: 3% of all cases of PAP. 5 to 10% of all cases of PAP. 2% of all cases of PAP. 23. Peak age of onset 30 to 40 years. Associated with conditions such as degree chronic infections, degree exposure to toxic substances, example etiology. Scent autoimmunity * genetic mutations, chemotherapeutic agents, scent genetic mutations, degree myelodysplastic syndromes, malignancy, immunodeficiency, example due to HIV infection/AIDS. QL. Collapse. Fine text outline. Degree. X rare inherited syndromes. Pulmonary alveolar proteinosis, PAP. Overview of Pool Y alveolar P, 22L23 primary PAP characteristics, secondary PAP, congenital PAP, autoimmune PAP, hereditary PAP. Definition: syndromes characterized by the progressive accumulation of surfactant protein in the alveoli. Asterisk 90% of all PAP cases A7, asterisk prevalence, 6-7:1,000,000 epidemiology asterisk 3% of all cases of PAP asterisk 5 to 10% of all cases of PAP asterisk 2% of all cases of PAP 23 asterisk peak age of onset, 30 to 40 years. Associated with conditions such as degree chronic infections or exposure to toxic substances, example etiology autoimmunity, scent genetic mutations, chemotherapeutic agents, scent genetic mutations o myelodysplastic syndromes, copyright malignancy, copyright immunodeficiency, example due to HIV infection/AIDS. Scent mutations in genes encoding for GM-CSF, scent mutations in genes coding for surfactant proteins asterisk production of GM-CSF, III receptor subunits, dysfunctional GM-CSF. Example surfactant protein C, involved in lung autoantibodies. VE underlying cause number and stream DNON of alv/SLAC receptors on alveolar macrophages, inability 5 stir size of Haig's development, example NKX 2.1, or surfactant lipid pathophysiology to bind GM-CSF, ability to remove PE inclusion, ABCA 3, production of abnormal macrophages, preg surfactant. Progressive surfactant accumulation in the alveoli interferes with gas exchange. Dyspnea, cough, dry or productive, hemoptysis, cyanosis, weight loss, fatigue, malaise. Clinical features. Clinical history: X-ray/CT chest shows a characteristic pattern of ground glass opacity and reticular densities, crazy paving pattern. Diagnostics: 9 cents bronchoalveolar lavage, scent possibly lung biopsy. Asterisk whole lung lavage, excess surfactant is removed from the lungs via saline treat. Solution: may require repeated application. Asterisk treatment of the underlying scent, supportive treatment subcutaneous injection or experimental inhalation of GM-CSF may be beneficial. Condition: lung transplantation in autoimmune PAP, as might treatment with rituximab and/or plasmapheresis. Secondary infections: respiratory failure, lung fibrosis, complications. 7AE. Familial lipoprotein lipase deficiency. Scent definition: an inherited genetic condition characterized by lipoprotein lipase, LPL, enzyme deficiency, which leads to hyperchylomicronemia. Plus epidemiology, 1:250,000, 24. Scent etiology, caused by mutations of the LPL gene. Pathophysiology, gene mutations, LPL deficiency, breakdown of chylomicrons, hyperchylomicronemia. Scent clinical features. Copyright episodic epigastric pain of varying intensity, cohepatosplenomegaly o eruptive cutaneous xanthomas o lipemia retinalis o neuropsychiatric symptoms, example depression. Scent diagnostics. Copyright clinical history o blood tests, LPL activity. Copyright confirmatory molecular genetic. Scent treatment, lifestyle modifications, example dietary restriction of fat, avoidance of alcohol and drugs that increase triglyceride levels. References: 241 equals QL. Collapse fine text outline. Euro rare inherited syndromes, 1/5. Normal chromosome 15 mpgyc at p, paternal chromosome mm maternal chromosome. Plus active allele Je methylated/silenced allele of mutated/deleted allele. 4 Prader-Willi syndrome, Angelman syndrome, MPPPGQA GQA. Or WWESOE. Etiology of Prader-Willi and Angelman syndromes VV. Copyright Boss. Rare inherited syndromes, 2/5. Prader-Willi syndrome. Epidemiology prevalence 1 in 16,000 to 25,000. Etiology paternal deletion 15q11q13, 70%. Maternal uniparental disomy low risk of inheritance, mostly spontaneous mutation, etiology similar to that of Angelman syndrome. Complications obesity and sequelae, example diabetes mellitus and respiratory disorders. Prognosis partial autonomy is possible. Life expectancy slightly below normal if obesity can be controlled. Uncontrolled appetite with hyperphagia, learning difficulties, cognitive deficits, low impulse control, defiant behavior, psychosis. Prader-Willi syndrome fact sheet. Copyright Boss. Short stature. Narrow bridge of nose. Almond-shaped eyes, -3 plus *3 slight strabismus K, FNF pi thin upper lip, downturned corners of the mouth. Scoliosis est / AES / Obesity IIE equals /EE, LANP1 hypogonadism, WEL / small hands /TBH asses and feet / tie, tip VV. Rare inherited syndromes, 3/5. Child with Prader-Willi syndrome VV. Child of primary school age with massive obesity and a short stature. Both features are typical in children with Prader-Willi syndrome. Source, Figure 1 in, characteriza C6N clinico-genetico-molecular de 45 pacientes chilenos con síndrome de Prader-Willi by Fanny Cortez METAL, Revista Medica de Chile Journal, licensed under CC by 4.0. Rare inherited syndromes, 4/5. Angelman syndrome. Epidemiology worldwide prevalence, 4-8/100,000 G6 equals 2. Etiology maternal deletion 15q11q13, 70%. Rarely paternal uniparental disomy low risk of inheritance, mostly spontaneous mutation, etiology similar to Prader-Willi syndrome. Prognosis autonomy is never achieved. Life expectancy normal. Severe intellectual deficiency severe speech development disorders cheerful demeanor with frequent smiling hyperactivity associated with hand flapping movements seizures. Angelman syndrome fact sheet. Copyright Boss. Strabismus. Conspicuously broad mouth, wide-spaced teeth. O equals -- thoracic scoliosis equals, in advanced age, equals, especially to. Hyperreflexia. Ataxic gait. Rare inherited syndromes, 5/5. AAE non-disjunction / 3 in meiosis different 5, fertilization SY, / homologous 1/8 beg NE chromosomes equals from one parent trisomy. Trisomy rescue through ejection of the paternal chromosome. / fertilization pH, 9 non-disjunction GG at VE identical in meiosis 2 homologous KY monosomy rescue chromosomes equals 4, _ through mitotic replication from one parent 9 fertilization, A equals Fe, 2J cent. Normal. Uniparental disomy VV. Copyright Boss. E. Fragile X syndrome. Epidemiology approximate 1 in 8,000 females and 1 in 4,000 males second most common cause of congenital cognitive disorders after trisomy 21. Etiology mutation of the FMR1 gene, CGG trinucleotide repeat expansion, X-linked inheritance. Complications epilepsy. Note milder manifestations in heterozygous female, mostly neuropsychiatric disorders, rarely cognitive deficits. Life expectancy typically normal. Fragile X syndrome fact sheet. Copyright emboss. Rare inherited syndromes, 1/3. Characteristic facies. Prominent forehead and increased head circumference, long, slim face. Hyperactivity, cognitive deficits, delayed speech development, autistic behavior. Large ears plus. Prominent, pointy chin plus. LR/connective tissue weakness. SY mitral valve prolapse. Testicular_dash plus_ F% RI /we_ZMS11HH/SIOE equals OLB/S. Hypermobile joints. Pes planus. Rare inherited syndromes, 2/3. Facial features of Fragile X syndrome. Macrocephaly and large earlobes. Source: File frags2.jpg by Peter Saxon, Wikimedia Commons, licensed under CC by SA 4.0. Modifications: eyes pixelated. Rare inherited syndromes, 3/3. Fragile X syndrome VV. Boy of primary school age with a long and narrow face and large ears. Both features are typical in children with Fragile X syndrome. Source: Frags1 by Peter Saxon, Wikimedia Commons, licensed under CC by SA 4.0. Modifications: eyes blurred. Rare inherited syndromes, 1/1. CRI-Duchat syndrome characteristic facies. Epidemiology: approximately 1:45,000 live-born infants. And P-sex, copyright and, 2:1, cognitive deficits else #. Epicanthal folds etiology: structural aberration of the short arm AF Krierigor 5 cat-like cry broad bridge of /nose. Karyotype == TSXX5P microgenia 3, 46XY-5-PA short stature. Note / degree cardinal symptom is a cat-like cry, skeletal anomalies during infancy / scoliosis. Life expectancy / narrow may be normal, depending on severity of /square iliac crest symptoms and treatment Q, X. \EXV equals Y4. U \VYY single transverse X \GI polar NES DNS shortened meta L carpal and meta YY, tarsal bones. CRI-Duchat syndrome, cat cry syndrome, fact sheet VV. Copyright emboss. Rare inherited syndromes, 1/2. Williams syndrome elfin facies. LE. Fagae broad forehead epidemiology itemia by GJAK1/10,000 live births 4, AT low nasal bridge S ria Y. Etiology tet patty NSX NWJ1 strabismus. Microdeletion on chromosome 7 stellate pattern in the iris short palpebral fissures, includes deletion of elastin gene. \L hyperacusis mostly spontaneous mutation, rarely de autosomal dominant inheritance plus upturned tip of TR, the nose laboratory findings long philtrum. Intermittent hypercalcemia, \/ mainly during early childhood, due to increased vitamin D sensitivity, a \3 Zenlartia ens Hans. EET example renal artery stenosis complications, e.g.y, mostly cardiovascular gastrointestinal symptoms, vomiting F \/ and, subsequently, failure TEISEY cardiac malformations ilear to T, especially supravalvular *++ reduced muscle tone aortic stenosis. Cognitive deficits typically sociable personality with good verbal skills, cocktail party personality, anxiety disorders, phobias. Williams syndrome fact sheet. Copyright Boss. Rare inherited syndromes, 2 halves. Williams syndrome. Photograph of a child with a broad forehead, midfacial hypoplasia, a short nose, with a flat nasal bridge, an everted lower lip, full cheeks and lips and low-set ears. This appearance is often described as elfin facies and commonly seen in Williams syndrome, although definitive diagnosis would require genetic testing. Source: Figure 1 in Williams-Buren syndrome associated with single kidney and nephrocalcinosis, a case report by Kamil Abidi, Mainal Jelule, Rania Ben Rabah, Yusra Hamai, Tahar Garga, The Pan-African Medical Journal, licensed under CC by 2.0. X differences, disorders, of sex development. Differences, disorders, of sex development, DSDs, formerly known as intersex conditions, are a group of congenital conditions characterized by the atypical development of chromosomal, gonadal, and/or phenotypic sex. The underlying genetic mutations can affect the number and function of sex chromosomes, example in Turner syndrome, cause structural changes that influence the sensitivity of hormone receptors, example androgen insensitivity syndrome, and alter the function of enzymes responsible for sex hormone synthesis, example congenital adrenal hyperplasia. Features vary depending on the specific disorder but may include the mismatch between sexual genotype and phenotype, reduced fertility or infertility, and organ malformations, example cardiac abnormalities. The discrepancy between sexual phenotype and genotype can cause difficulties in gender identification with considerable subsequent psychological distress. The diagnosis of DSDs is based on clinical features, evaluation of hormone levels, and genetic testing. Differential diagnosis should take into account other anomalies of the male and female genital tracts, see the articles on anomalies of the female genital tract and infertility. Treatment should be provided based on patient preference and sexual identification as well as clinical necessity backed by strong ethical principles. If treatment is necessary and/or desired, it generally follows a multidisciplinary approach involving hormone substitution and psychological counseling. Gender affirmation surgery should only be performed if the patient expressly requests the procedure and can provide informed consent. ORU. Overview. Differences, disorders, of sex development. Definitions. Scent differences, disorders, of sex development, DSDs, a group of congenital conditions characterized by the atypical development of chromosomal, gonadal, and/or phenotypic sex. Scent historical terms. Intersex equals a historical term replaced now by the widely accepted terms disorders of sex development proposed in the 2006 Chicago Consensus Statement or the more recently introduced variation differences of sex development. 2 equals this notwithstanding, the term intersex may be an accurate sex assignment designator for certain individuals with a DSD who do not identify as binary male or female. Copyright true hermaphroditism, presence of both male and female reproductive tissue and/or organs. Pseudo-hermaphroditism, mismatch between gonads and secondary sexual characteristics equals male pseudo-hermaphroditism, male gonads, female secondary sexual characteristics equals female pseudo-hermaphroditism, female gonads, male secondary sexual characteristics. Classification 12. CENT46XYDSDO androgen insensitivity syndrome, most common cause, O5-alpha reductase deficiency. Copyright 17B hydroxysteroid dehydrogenase 3 deficiency. Copyright Kallman syndrome. O persistent Müllerian duct syndrome. O46XY complete gonadal dysgenesis, Swire syndrome, CENT46XXDSD. Copyright congenital adrenal hyperplasia, most common cause, O exposure to exogenous androgens during pregnancy. Copyright ovotesticular disorder of sex development. Copyright aromatase deficiency. O46XX gonadal dysgenesis. Copyright 46XX testicular DSD. CENT sex chromosome DSD. O Turner syndrome, 45X0O, O. Klinefelter syndrome, 47XXY, copyright double Y syndrome, 47XYY. Treatment. The clinical management of DSDs involves a multidisciplinary approach guided by clinical necessity, patient choice, and strong ethical principles. Physicians should consider the following when determining the best treatment options for patients with DSDs: copyright ethical and human rights aspects of sex assignment and reassignment surgery, copyright patient gender identity independent of chromosomal or phenotypical sex, psychological distress resulting from stigmatization, discrimination, and difficulties developing gender identity, example gender dysphoria, copyright patient choice 1, copyright clinical necessity 1, types of treatment, hormone substitution, back collapse, fine text outline. Types of treatment: hormone substitution, psychological support, surgery. Gonadectomy gender affirmation surgery. Chromosomal abnormalities. Condition: Turner syndrome, Klinefelter syndrome, double Y syndrome. Genetic disorders. Condition: congenital adrenal hyperplasia, CAH. Aromatase deficiency. Ovotesticular disorder of sex development. Back. Underlying cause. Plus 45X monosomy. Asterisk 47XXY trisomy 1. Asterisk 47XYY trisomy. Underlying cause. Overview of chromosomal abnormalities, gonadal dysfunction. Ovarian dysgenesis, streak gonads. Testicular dysgenesis, testicular hypoplasia, testosterone deficiency. Normal gonadal function. Overview of genetic disorders. In both 46XY and 46XX karyotypes. Autosomal recessive gene mutation encoding any of the following: copyright 21 hydroxylase, degree 17A hydroxylase, copyright 11B hydroxylase. Autosomal recessive CYP19A1 gene mutations. Asterisk SRY gene translocation from Y to the X chromosome. Increased or decreased androgen production. Gonadal dysfunction. Copyright patient choice, copyright clinical necessity. Clinical features. Infertility, webbed neck, cystic hygroma, shield chest, coarctation of the aorta, horseshoe kidney. Unicoidism, gynecomastia, reduced facial and body hair, testicular atrophy, mitral valve prolapse. Normal fertility and pubertal development, tall stature, severe acne associated with copyright ADHD, copyright autism spectrum disorder. Other clinical features. 21 hydroxylase and 11B hydroxylase deficiencies, copyright hypotension, hypertension in 118 hydroxylase deficiency, degree precocious puberty in boys, depending on the defective/deficient enzyme. Asterisk defective/absent aromatase, asterisk decreased estrogen and increased androgen production. Asterisk ovotestis. ANN collapse. Mixed testicular and ovarian dysgenesis. Fine text. 17A hydroxylase deficiency, copyright hypertension, delayed puberty in girls, C congenital adrenal hyperplasia. In 46XX individuals, ambiguous external genitalia, copyright normal internal genitalia, copyright virilization, copyright amenorrhea. In 46XY individuals, abnormal sperm production, copyright small or undescended testes, both copyright tall stature, copyright osteoporosis, copyright hyperglycemia, copyright weight gain and fatty liver. In 46XX individuals, copyright labial fusion, copyright urogenital sinus. In 46XY individuals, copyright hypospadias, copyright cryptorchidism, testicular enlargement, degree gynecomastia, both copyright ambiguous genitalia, degree infertility. AA. Outline. Mutations in multiple genes responsible for the migration of GnRH-releasing neurons from the olfactory bulbs call Mann syndrome. Autosomal dominant SOX9 gene mutations on chromosome 17 C campomelic dysplasia in short stature. SOX9 mutation, campomelic dysplasia, impaired transcription of sex-determining factors. Hypogonidotropic hypogonadism. Example: anti-Müllerian hormone. In 46XY karyotype only. CENT-X-linked recessive mutation of the androgen receptor gene. Autosomal recessive loss of function mutation of 5-alpha reductase deficiency SERDSA2 gene. Persistent Müllerian duct plus autosomal recessive mutation of AM or AMHR2 gene syndrome. HSD17B3 gene mutation with 17B hydroxysteroid dehydrogenase 3 deficiency 17B hydroxysteroid dehydrogenase 3 deficiency. 46XY gonadal dysgenesis mutations of SRY, MAP3K1, NR5A1 or DHH gene, Swire syndrome. Insensitivity to androgens, normal androgen production. Decreased conversion of testosterone to dihydrotestosterone. Decreased production of N/or insensitivity to anti-Müllerian hormone, AM. Decreased conversion of androstenedione to testosterone. Testicular dysgenesis streak gonads, decreased androgen production. In 46XX karyotype only. 46XX gonadal dysgenesis * most commonly mutations of BMP15 or NR5A1 gene. Translocation of the SRY gene from the Y chromosome 46XX testicular DSDA to the X chromosome /. Congenital malformations of the reproductive system. Ovarian dysgenesis streak gonads. Small or undescended testes absent Müllerian duct structures testosterone deficiency. Overview of malfor of the reproductive YST. Condition underlying cause. Anomalies of Müllerian duct scent defective fusion of the Müllerian ducts during embryonal development fusion * see anomalies of the female genital tract. Imperforate hymen failed apoptosis of the central epithelial cells of the hymen. Transverse vaginal septum scent failed recanalization of the Müllerian duct. Collapse. Scent impaired development of the ventral abdominal wall and bladder during the cloacal membrane rupture V = A. Find text. Infertility absent or attenuated pubertal changes anosmia or hyposmia renal agenesis cleft lip / cleft palate. Ambiguous external and/or internal genitalia skeletal dysplasia. Degree bowing of long bones copyright short stature Pierre Robin sequence life-threatening laryngotracheomalacia hearing loss. Female phenotype blind-ended vaginal pouch uterine agenesis crypt orchid testes primary amenorrhea infertility scant or missing pubic hair. Female external genitalia male internal genitalia pseudovaginal perineoscrotal hypospadias development of secondary sexual male characteristics in puberty. Male phenotype female internal genitalia cryptorchidism inguinal hernia hematospermia and hematuria. Male internal genitalia, testes, ambiguous or undervirilized external genitalia, gynecomastia. Infertility. Female phenotype small uterus enlarged clitoris delayed puberty, absence of breast enlargement primary amenorrhea infertility. Female phenotype normal internal genitalia, uterus and vagina, infertility. Male phenotype short stature, gynecomastia azoospermia related infertility. Clinical features. Infertility dyspareunia primary amenorrhea, in Müllerian agenesis. Primary amenorrhea hematocolpo-palpable abdominal mass urinary retention dysuria. Primary amenorrhea hematocolpo infertility lower abdominal pain. Bladder herniation through the abdominal wall urinary incontinence epispadias in male individuals. Short penis O. Outline. Asterisk impaired development of the ventral abdominal wall and bladder during the cloacal membrane rupture, a bladder exstrophy. 7 VOA2. Androgen insensitivity syndrome. Scent prevalence, 25:100,000 genetically male population in the US. For etiology, X-linked recessive mutation of the gene encoding the androgen receptor, AR gene, E karyotype, 46XY. Scent pathophysiology, defects in the androgen receptor result in varying degrees of end organ insensitivity to androgens. Scent clinical features. Copyright complete androgen insensitivity equals female external genitalia and physique equals due to increased aromatization of androgens to estrogens equals includes testicular feminization and female breast development equals blind-ended vaginal pouch, uterine and fallopian tube agenesis, due to testicular anti-Müllerian hormone secretion, absent male internal genitalia, with the exception of the testes, 1 equals crypt orchid testes, intralabial, inguinal, or abdominal localization of undescended testicles equals scant or no pubic hair equals primary amenorrhea, infertility, no menarche. Bladder herniation through the abdominal wall, urinary incontinence, epispadias in male individuals. Copyright short penis. Copyright dorsal penile curvature. Copyright indirect inguinal hernia in female individuals. Copyright bifid clitoris, E anteriorly separated labia, E bicornuate uterus. Copyright partial androgen insensitivity, various phenotypical configurations possible, depending on the degree of androgen insensitivity. A. Scent diagnostics. Copyright clinical presentation before puberty, T testosterone, O after puberty, T LH, T estrogen, and normal/T testosterone levels, no virilization. Copyright genetic testing. Scent treatment, depends on receptor status as well as on the phenotype and gender identity. Copyright hormone treatment equals complete androgen insensitivity, estrogen replacement. IA equals partial androgen insensitivity, high-dose androgen therapy in patients with male gender identity. A. Copyright gonadectomy, for intra-abdominal/intralabial testicles equals typically performed after puberty equals prevents malignant transformation of the abnormally localized gonads. Copyright psychological support. OO. FO, Cs. Aromatase deficiency. Plus prevalence, rare 15 cent. Etiology, autosomal recessive mutations in the CYP19A1 gene that encodes the enzyme aromatase, 6, karyotype, 46XX or 46XY, normal sexual development in males, pathophysiology, defective/absent aromatase conversion of testosterone to estrogen, serum estrogen and TT serum testosterone. Scent clinical features. Copyright 46XX individuals equals at birth equals ambiguous external genitalia, normal internal genital organs 1 equals puberty. Back collapse. Find text. O. Outline equals puberty equals impaired maturation of secondary sexual characteristics, example breast growth, equals primary amenorrhea 1, virilization, features include hirsutism, severe acne. Copyright 46XY individuals 1 equals abnormal sperm production equals small or undescended testes equals decreased sex drive. O. Both 46XX and 46XY individuals equals tall stature, due to excessive bone growth with slowed mineralization, equals osteoporosis, may result in fractures following minimal trauma, equals hyperglycemia, due to impaired tissue response to insulin, equals weight gain and fatty liver. Scent diagnostics. O. Before birth, maternal virilization during pregnancy, due to fetal androgens crossing the placenta and entering maternal circulation. O. After birth equals clinical presentation of the newborn equals hormone levels, T testosterone, T androstenedione, estrogen equals karyotyping, normal 46XX or 46XY karyotype. Scent treatment. O. Estrogen and progesterone replacement therapy. Copyright calcium and vitamin D supplementation. Copyright surgical correction of ambiguous genitalia, depending on the patient's gender identity and preference. 2 asterisk. OFOs. 5. Alpha reductase deficiency. Prevalence, rare disease, exact incidence unknown. 1/7 etiology, rare autosomal recessive loss of function mutation of the SRD5A2 gene on chromosome 2 karyotype. 46XY pathophysiology, defective 5-alpha reductase conversion of testosterone to dihydrotestosterone, DHT, DHT-dependent masculinization of external genitalia and the prostate, despite normal testosterone production. Clinical features 8.0 female external genitalia at birth. 1 copyright possibly pseudovaginal. Perineoscrotal hypospadias, PPSH. A symptom constellation of hypospadias, a micropenis that resembles a clitoris, and an incompletely closed urogenital opening that resembles a vagina. O male internal genital organs. O development of the secondary sexual male characteristics, phallic growth, testicular descent, in puberty due to high testosterone levels. Diagnosis copyright clinical presentation. O hormone levels equals normal / testosterone, DHT, testosterone DHT ratio 20, equals normal. Estrogen equals normal or TTLH. Copyright genetic testing, confirms the diagnosis. Sent treatment. O female gender identity, gonadectomy and estrogen substitution therapy upon completion of longitudinal growth. O male gender identity, testosterone substitution. Copyright surgical correction of hypospadias and cryptorchidism. 9. O. OFOs. Klinefelter syndrome. E-prevalence copyright approximate 1:650 population in the US 9. One of the most common causes of male hypogonadism. Etiology. Back collapse. Find text outline. Etiology. Usually due to non-disjunction of sex chromosomes during meiosis. Associated with advanced maternal age. Karyotype 47XXY, rarely 48XXXY or 48XXYY. Presence of a bar body, inactivated X chromosome, plus pathophysiology. Copyright testicular dysgenesis leads to, equals seminiferous tubules dysgenesis. Loss of Sertoli cells. Inhibin BTFSH equals Leydig cell dysfunction. Testosterone TLHO. Both TTLH and 7-FSH lead to increased conversion of testosterone to estrogen. Asterisk clinical features, testicular dysgenesis and subsequent testosterone deficiency manifest at the onset of puberty. Symptoms are rare during childhood. Copyright signs and symptoms of hypoandrogenism. A unicoid growth pattern, tall, slim stature with long extremities, growth plate closure is delayed. I3ZSBP. Reduced facial and body hair. Testicular atrophy. Reduced fertility and libido. Frequent azoospermia. Micropenis, osteoporosis, common feature in adulthood. I copyright possible developmental delay equals neurocognitive dysfunction, impaired executive function and memory, decreased intelligence, equals language impairment, affects expression more than comprehension, equals poor social skills. Copyright associated disorders equals mitral valve prolapse equals increased risk of breast and testicular cancer. Metabolic syndrome. Sent diagnostics degree clinical presentation. O hormone levels equals 1 FS hand LH equals testosterone with T aromatase and T estrogen levels. Equals seminiferous tubules fibrosis Leydig cells hyperplasia. O karyotyping, confirmatory tests. Sent treatment, lifelong testosterone substitution. 1. GY. Y syndrome. Prevalence, approximate 1:1,000 male newborns in the US. 1 etiology, paternal meiotic non-disjunction karyotype, 47XYY or 46XY/47XYY. Mosaicism. Clinical features, 21O male phenotype, patients often remain undiagnosed, degree tall stature. O may manifest with severe acne. O normal fertility and pubertal development. Copyright mild delays in motor and language development. 1.0 higher rates of ADHD, autism spectrum disorder, and learning disabilities. Sent diagnostics. Copyright clinical presentation. Copyright karyotyping, confirmatory tests, Scent treatment EO not recommended in asymptomatic patients. O neurodevelopmental evaluation and treatment for ADHD or autism may be indicated. Back collapse fine text. O. Outline. Contrary to what is frequently still stated in the literature, there is no evidence that individuals with double Y syndrome have higher levels of aggression compared to karyotypically normal male individuals with comparable levels of intelligence. Ovotesticular disorder of sex development. Asterisk prevalence, less than 1:20,000 population in the US3 cent etiology, SRY gene translocation from the Y to the X chromosome, rarely to other chromosomes, karyotype, typically normal, 46XX is more common than 46XY, pathophysiology, SRY gene translocation results in simultaneous development of male and female gonads, ovotestis. Asterisk clinical features, 13. Copyright 46XX individuals equals at birth equals labial fusion equals urogenital sinus equals polycystic ovaries equals puberty/adulthood, primary amenorrhea, if the uterus does not form. Copyright 46XY individuals equals at birth equals hypospadias equals cryptorchidism equals puberty/adulthood equals gynecomastia equals recurrent groin or scrotal pain equals testicular enlargement degree. Both female and male individuals equals ambiguous genitalia, ovotestis, equals can be bilateral, more common, or unilateral equals descent depends on amount of testicular tissue present in ovotestis. Equals can be intra-abdominal, most commonly, inguinal, or labioscrotal equals in some cases, a single testis and contralateral ovary may be present. Infertility J. E. Diagnostics. Copyright clinical presentation. Copyright chromosomal and genetic testing. Copyright biopsy of the gonads shows both testicular and ovarian tissue equals. Scent treatment. Surgical removal of male or female genital structures for normal sexual development according to gender identity and preference. 14. Gonadal dysgenesis. Scent description. Copyright a group of DSDs characterized by gonadal underdevelopment during embryogenesis, see classification below. O results in different degrees of hypogonadism and sex development. Copyright typically results in the development of malfunctioning gonads, streak gonads, with fibrous tissue instead of normal germ cells, increasing the risk of malignancy, example dysgerminoma, seminoma. Scent classification. E. Turner syndrome, 45XO, O. Pure gonadal dysgenesis, or complete gonadal dysgenesis, equals 46XY. Gonadal dysgenesis, Swire syndrome, equals 46XX. Gonadal dysgenesis. Scent general clinical features. O. Delayed puberty. O. Infertility. Copyright streak gonads. Back collapse fine text outline. Scent general clinical features. O. Delayed puberty. O. Infertility. O. Streak gonads. Copyright high risk for malignancies, example dysgerminoma, seminoma. Scent diagnosis. Copyright clinical presentation. O. Genetic analysis degree. Karyotyping. O. Laboratory findings of hypergonadotropic hypogonadism. O. Imaging tests, to assess for streak gonads. Scent treatment. O. Lifelong estrogen and progesterone substitution. Copyright surgical removal of streak gonads. OS. O-Road. Lee-Turner syndrome. E. Prevalence. O. Approximate 1:2,500 genetically female population in the U.S. 15 EO. Most common cause of ovarian dysgenesis and primary ovarian insufficiency plus etiology, chromosomal non-disjunction during meiosis or mitosis. Scent karyotype. Copyright meiotic non-disjunction, most often in paternal gametes, complete sex chromosomal monosomy, 45X0, no bar body. Copyright mitotic non-disjunction of an embryonic cell sex chromosomal mosaicism, 45X0/46XX, mild phenotypic expression. Pathophysiology, chromosomal non-disjunction X chromosome monosomy/mosaicism. Impaired ovarian development. Malfunctioning streak gonads with scent clinical features. O. Sex development equals female phenotype equals primary ovarian insufficiency with equals delayed puberty equals primary amenorrhea equals infertility. Pregnancy is still possible via VF using donor oocytes and exogenous estradiol 178 and progesterone, similar rates of success to those in the general population. 16 lymphatic system abnormalities equals cystic hygroma equals lymphedema of the hands and feet in the neonatal period. Copyright musculoskeletal findings. Short stature, due to the presence of only one copy of the Shoke's short stature homeobox gene, normally located on the X chromosome, shield chest, broad chest with widely spaced nipples, webbed neck, skin folds along the side of the neck between the mastoid process and the acromion cubitus valgus. Short fourth metacarpal / metatarsals, nail dysplasia, high arched palate, low set posterior hairline, osteoporosis and pathologic fractures. Copyright cardiovascular abnormalities equals bicuspid aortic valve, increased risk of premature aortic stenosis and / or insufficiency. Equals coarctation of the aorta with brachial femoral delay, aortic dissection and rupture, equals hypertension, even in children, 1171. Copyright other disorders, 8 equals gonadoblastoma, especially in patients with 45XO/46XY mosaicism, equals malformations of the kidney and ureters, especially horseshoe kidney, equals Hashimoto thyroiditis equals type 2 diabetes. Mellitus Scent Diagnostics. Copyright clinical presentation. Hypergonadotropic hypogonadism, estrogen, androgens, TFSH, TLH. Copyright karyotyping. Confirmatory test. Treatment estrogen and progestogen substitution. Copyright growth hormone, GH, therapy. Copyright surgical removal of streak gonads. Back collapse. Fine text outline. Copyright. Unlike Klinefelter syndrome, Turner syndrome is not associated with advanced maternal age. Most patients with Turner syndrome have normal intelligence. 9. Evaluate for X-linked recessive conditions in patients with Turner syndrome, as this group lacks a second X chromosome. MAD 00. Copyright Y and ES46XY gonadal dysgenesis. Scent prevalence, approximate 1:20,000 population in the U.S. 20 cent. Etiology, mutations of genes involved in male sex development after the G embryonic week. Copyright mutation of SRY gene on chromosome Y in approximate 20% of affected individuals. Copyright other potentially involved genes, MAP3K1, NR5A1, and DHH genes. Scent karyotype, 46XY plus. Pathophysiology 21O impaired testicular development and the subsequent underproduction of testosterone and anti-Müllerian hormone, which results in persistence of Müllerian ducts, development of female genitalia, except ovaries, despite the presence of Y chromosome equals underdevelopment of Wolffian ducts, absence of male genitalia. Copyright development of streak gonads, estrogen and progesterone, negative feedback TTFSH and LH, delayed puberty and infertility. Clinical features 22. Copyright typically female phenotype, copyright childhood, normal female development without evidence of a chromosomal aberration. Puberty, estrogen deficiency due to the absence of functional ovaries. 23 equals primary amenorrhea equals infertility equals small uterus equals enlarged clitoris equals absence of breast enlargement. Scent diagnostics, see diagnosis in gonadal dysgenesis section above. Plus treatment, see treatment in gonadal dysgenesis section above. 24. 8 shared N. Li 46XX gonadal dysgenesis. Plus prevalence, less than 1:10,000 population worldwide. 25 cent. Etiology, underlying etiology is unknown, but several gene mutations, especially of the BMP15 and NR5A11 genes, have been implicated. Scent karyotype, 46XX. Pathophysiology. Copyright gene mutations Impaired ovarian development during embryogenesis. Premature depletion of ovarian follicles with the development of streak ovaries. Copyright impaired estrogen secretion results in the underdevelopment of secondary sexual characteristics. Clinical features 2 degree, O female phenotype. Copyright childhood, normal development of female genitals, uterus and vagina. O puberty 7 equals impaired maturation of secondary sexual characteristics. Primary, rarely secondary. Amenorrhea equals infertility equals streak. Gonad scent diagnostics, see diagnosis in gonadal dysgenesis section above. Treatment, see treatment in gonadal dysgenesis section above. Back collapse. Find text outline. 46XX testicular disorder of sex development. Plus prevalence, approximate 1:20,000 male individuals in the US27E. Etiology, translocation of the SRY gene onto an X chromosome scent karyotype. 46XX*. Clinical features 27 O male phenotype. O small or undescended testes. O absent Müllerian duct structures. O gynecomastia. O infertility, due to azoospermia. Copyright erectile dysfunction. Copyright short stature. Diagnostics 28. Copyright clinical findings. O hormone levels, hypergonadotropic hypogonadism. O fish or PCR, SRY gene translocation scent. Treatment, testosterone replacement therapy to induce the development of male secondary sex characteristics and prevent the development of gynecomastia. OFOS. Kallman syndrome. Prevalence, 3:100,000 male and 0.8:100,000 female population in the US. 29 cent karyotype, 46XY or 46XX cent. Etiology, associated with more than 20 different gene mutations that result in the development of hypogonadotropic hypogonadism with hyposmia/anosmia. Plus pathophysiology 2 degrees. Copyright defective migration of GnRH releasing neurons from the olfactory bulbs to the hypothalamic preoptic nuclei. GnRH secretion and underdevelopment of the olfactory bulbs. O GnRH pituitary secretion of FSH and LH. Testosterone in male individuals and estrogen in female individuals. Clinical features, phenotype according to karyotype 80. O anosmia or hyposmia. O infertility equals male individuals, cryptorchidism and low sperm count equals female individuals. Primary amenorrhea. O absent or attenuated pubertal changes equals decreased growth spurt equals male individuals, reduced or no facial and body hair, lack of voice changes, no muscle bulk equals female individuals, reduced or no axillary hair, absent thelarchy. Copyright osteoporosis. Copyright in rare cases, neurological manifestations, example ataxia, focal dystonia, bimanual synkinesia. 31 Copyright associated disorders equals renal agenesis equals cleft lip/cleft palate equals dental agenesis equals cleft hand or foot equals syndactyly equals hearing loss. Scent diagnostics. Copyright clinical presentation. O hormone levels, levels of GnRH, FSH, LH, estrogen/testosterone, otherwise normal pituitary function. Plus treatment. 82 O hormone replacement therapy is given in puberty to stimulate the development of secondary sexual characteristics. Equals in male individuals, testosterone equals in female individuals, estrogen and progesterone combination therapy. Copyright gonadotropins or pulsatile GnRH therapy can be used to increase fertility. Equals in male individuals, stimulates testicular growth and sperm production. Equals in female individuals, stimulates ovulation. Back collapse. Find text outline. X differences, disorders, of sex development. Plus treatment. 82 O hormone replacement therapy is given in puberty to stimulate the development of secondary sexual characteristics. Equals in male individuals, testosterone equals in female individuals, estrogen and progesterone combination therapy. Copyright gonadotropins or pulsatile GnRH therapy can be used to increase fertility. Equals in male individuals, stimulates testicular growth and sperm production. Equals in female individuals, stimulates ovulation. OO. OROA. Persistent Müllerian duct syndrome. Prevalence, rare disease, exact prevalence unknown. Etiology, insufficient anti-Müllerian hormone, AMH, or insensitivity to AMH due to AMH gene or AMHR2 gene mutation. Karyotype, 46XY. Pathophysiology, AMH deficiency/insensitivity. Persistence of the Müllerian duct plus development of uterus, cervix, fallopian tubes, and upper two-thirds of the vagina in 46XY individuals. 33. Clinical features. 4. Normal male external genitalia and secondary sexual characteristics. Female internal genitalia. Copyright increased risk of cryptorchidism and inguinal herniation in infancy. Hematospermia and hematuria. Infertility. Diagnostics. Copyright often discovered incidentally during orchidopexy. Elisa. Decreased levels of AMH plus treatment. 25. Copyright orchidopexy/herniatomy. Copyright surgical removal of remnants of the Müllerian duct. WA CE 17B hydroxysteroid dehydrogenase 3 deficiency. 41 plus prevalence approximate 1:147,000 individuals. 87 etiology autosomal recessive mutation of the HSD17B3 gene, which encodes for the enzyme 17B hydroxysteroid dehydrogenase 3. Karyotype, 46XY. Pathophysiology, 17B hydroxysteroid dehydrogenase 3 conversion of androstenedione to testosterone. Testosterone levels. Signs and symptoms of hypoandrogenism. Clinical features. Copyright before puberty equals male internal genitalia, testes, ambiguous or undervirilized external genitalia equals female type, blind ending vaginal pouch with clitomegaly and / or labial fusion equals male type, micropenis with hypospadias. After puberty equals development of male secondary sex characteristics, example male hair distribution, voice deepening, equals gynecomastia equals infertility. Diagnostics. 34 Copyright clinical presentation. Copyright positive HCG stimulation test, T androstenedione levels and testosterone androstenedione ratio after HCG administration. Treatment, surgical correction of ambiguous genitalia and / or gonadectomy, based on the patient's gender identity and preference. Back collapse. Fine text outline. Euro differences, disorders, of sex development, 3/3. Complete androgen insensitivity syndrome. Pathophysiology. X-linked recessive mutation in the AR gene. Androgen receptor dysfunction. End organ scant or no / insensitivity to androgens. Pubic and axillary hair. Karyotype, 46XY7, female breast development. Diagnosis. Genetic testing. ETT testosterone, TLH. Uterine and fallopian tube agenesis. #primary amenorrhea and infertility. Phenotype, female LLN cent, yen. Female eye treatment. External SSE gonadectomy to prevent malignancy, genitalia. QO undescended cent hormone therapy with onset of puberty depending potestes on gender identity plus blind-ended vaginal pouch. Complete androgen insensitivity syndrome. VV. Copyright Boss. And differences, disorders, of sex development, 2/3. Partial androgen insensitivity syndrome, PASE. In this patient with PASE, multiple hypospadia repair operations resulted in an insufficient penis, phalloplasty and an erectile implant were subsequently performed, photograph taken preoperatively. The phenotypical presentation of PASE varies depending on the degree of androgen insensitivity and may include hypospadias. Source, Fig 3b, in Key Discussions from the Working Party on Disorders of Sex Development, DSD, Evaluation, Foundation Merieux, Annecy, France, March 14 to 17, 2012 by Lepier, Hauk CP, BMC, licensed under CC by 2.0. Modifications, removal of the letter B. Complete androgen insensitivity syndrome, ACE. Front and side view of a 30-year-old patient with primary amenorrhea, left, and intra-abdominal laparoscopy findings, right. The normally developed breasts indicate a female phenotype, but the small labia and lack of pubic hair suggest ACE. Intraoperative laparoscopic view shows undescended testes inside the abdominal cavity. Source: Fig 1 and Fig 3, in Complete Androgen Insensitivity Syndrome or Testicular Feminization, review of literature based on a case report by Suhail R., Amin S., Nadia Aetal, PAMJ, licensed under CC by 4.0. Modifications: 2 figures merged into one. Differences, disorders, of sex development, 1/1. Voice deepening. Male facial, body, and male internal genitalia pubic hair. Plus undescended muscle growth karyotype A/testis. SAD of phallic growth. /NE prostate testicular descent // W. Blind-ended vaginal pouch. Female or undervirilized external genitalia. 5-alpha reductase deficiency VV. Individuals with 5-alpha reductase deficiency are karyotypically male but often grow up with a female gender identity. At birth, external male genitalia and the prostate are underdeveloped because these organs are dependent on dihydrotestosterone for in utero development. During puberty, testosterone levels increase, resulting in the development of secondary male sexual characteristics, and some individuals undergo a change in gender identity. Copyright Boss. Euro differences, disorders, of sex development, 4/4. Tall stature Klinefelter syndrome. Epidemiology incidence approximate 1:650 in the U.S. Etiology usually due to non-disjunction of sex chromosomes EI. During meiosis. Hex. Associated with an advanced gynecomastia-E maternal age. Reduced facial and body hair, female body hair distribution. Karyotype mitral valve prolapse 47XXY, rarely 48XXXY or 48XXYY, testicular hypoplasia, bar body is present, reduced fertility. Phenotype I, Y male ul. Important possible developmental delay, onset of symptoms usually at the start of puberty, one of the most common causes of male hypogonadism. Klinefelter syndrome fact sheet. Copyright Boss. Sertola cells Linabin BTFSH. Leydig cells testosterone TLH. _long extremities. Osteoporosis plus. Euro differences, disorders, of sex development, 3/4. Overlay. Testis in Klinefelter syndrome VV. Photomicrograph of a testis tissue specimen, H&E stain, very high magnification, prominent, hyperplastic Leydig cells, green overlay, are visible, and the seminiferous tubules, hatched green overlay, have a hyalinized, fibrotic appearance. These findings are characteristic of Klinefelter syndrome. Source: File Klinefelter syndrome-1.jpg by Department of Pathology, Calicut Medical College, Wikimedia Commons, licensed under CC by SA 4.0. Euro differences, disorders, of sex development, 3/4. Overlay. Testis in Klinefelter syndrome VV. Photomicrograph of a testis tissue specimen, H&E stain, very high magnification, prominent, hyperplastic Leydig cells, green overlay, are visible, and the seminiferous tubules, hatched green overlay, have a hyalinized, fibrotic appearance. These findings are characteristic of Klinefelter syndrome. Source: File Klinefelter syndrome-1.jpg by Department of Pathology, Calicut Medical College, Wikimedia Commons, licensed under CC by SA 4.0. Source: Copyright IMPP. bilateral gynecomastia in Klinefelter syndrome. Euro differences, disorders, of sex development, 1/4. Klinefelter syndrome. Testicular hypoplasia and bilateral gynecomastia are characteristic features of Klinefelter syndrome. Source, copyright IMPP. Euro differences, disorders, of sex development, 1/1. Overlay. Ovotestis VV. Photomicrograph of a testicular biopsy specimen, H&E stain, low magnification, multiple seminiferous tubules with small round Sertoli cells in the lumen are visible, examples indicated by green overlay. There are several round primordial follicles, which consist of oocytes surrounded by follicular cells, examples indicated by red overlay. These findings indicate ovotestis. Source, Figure 1 in 46.xx ovotesticular disorder in a Mexican patient with Beckwith-Wiedemann syndrome, a case report by Nelly Margarita Macias Gomez, Evelia Lilugard, Melva Gutierrez Angulo, Guadalupe Dominguez Quezada, Horacio Rivera and Patricio Barros Núñez, Journal of Medical Case Reports, licensed under CC by 2.0. Differences, disorders, of sex development, 1/1. Overlay. Ovotestis VV. Photomicrograph of a testicular biopsy specimen, H&E stain, low magnification, multiple seminiferous tubules with small round Sertoli cells in the lumen are visible, examples indicated by green overlay. There are several round primordial follicles, which consist of oocytes surrounded by follicular cells, examples indicated by red overlay. These findings indicate ovotestis. Source, Figure 1 in 46.xx ovotesticular disorder in a Mexican patient with Beckwith-Wiedemann syndrome, a case report by Nelly Margarita Macias Gomez, Evelia Lilugard, Melva Gutierrez Angulo, Guadalupe Dominguez Quezada, Horacio Rivera and Patricio Barros Núñez, Journal of Medical Case Reports, licensed under CC by 2.0. High arched palate epidemiology web neck approximate 1/2.500 a shield chest UN etiology non-disjunction during meiosis, 45XO, or non-disjunction during low-set posterior mitosis of an embryonic cell is hairline / eukaryotype RAS, cubitus valgus 45XO, female phenotype SS // A kidney and ureter important cardiovascular abnormalities / malformations not associated with maternal age, Euro 0.8, coarctation of the aorta, / example horseshoe kidney. Life expectancy /YYA. Reduced by greater than 10 years VL / Gonadal dysgenesis with streak gonads leading to delayed puberty, primary amenorrhea, and infertility. At estrogen J androgen 7 FSH lymphedemia, hands and LH feet, during neonatal, hypergonadotropic period, nail dysplasia, hypogonadism, osteoporosis short fourth / metacarpal / metatarsals. IY by / SSSY. Turner syndrome fact sheet. Copyright Boss. Euro differences, disorders, of sex development, 1/1. Kallmann syndrome. Pathophysiology clinical features. Registered pnosmias / typosmies at 1. Decreased growth spurt hypogonadotropic vs. 2. Hypogonadism. == 3. No voice change NAS and reduced or number 2, axillary hair. GnRH releasing neurons. AES 5, hypothalamus now muscle-wise. Increase in puberty recribriform plate reduced or no facial absent thelarchy and body hair. Olfactory 4 pituitary A / neurons cryptorchidism aju SS primary amenorrhea decreased testicular -- _ plus placode volume, 2/4 d small penile size y, /FFI low sperm count. Copyright R. Argend. Cleft lip and palate J. Testosterone J. Estrogen renal. Omer J. Spermatogenesis J. Ovulation 8. Kallman syndrome VV. Copyright Boss. X. Ehlers-Danlos syndrome and Marfan S. Marfan syndrome, MFS, is an autosomal dominant connective tissue disorder that affects the microfibrils and elastin in connective tissue throughout the body. MFS is associated with disorders of the cardiovascular system, example mitral valve prolapse, aortic aneurysm, and dissection, the musculoskeletal system, example tall stature with disproportionately long extremities, joint hypermobility, and the eyes, example subluxation of the lens of the eye. Ehlers-Danlos syndrome, EDS, is a heterogeneous group of connective tissue disorders with variable inheritance, including hypermobility EDS and vascular EDS, characterized by defective collagen synthesis and processing. Symptoms include varying degrees of hyperextensive skin, joint hypermobility, and tissue fragility, including that of vasculature. The diagnosis of MFS and EDS is based on clinical criteria. Genetic testing can be used additionally to confirm or rule out the diagnosis of certain subtypes. Since there is currently no causal treatment for MFS or EDS, management typically involves an approach focusing on clinical features, including regular monitoring of complications, example imaging of aortic aneurysm, and preventive care, example antihypertensives to prevent aneurysm progression. Moss-Ent. Etiology and classification. Marfan syndrome, 1LL2I. Scent mutation of fibrillin 1 gene, FBN1, on chromosome 15 defective fibrillin, a glycoprotein that forms a supportive sheath around elastin, defective connective tissue microfibrils. Defective elastin scent. Several hundred different FBN1 mutations have been described in patients with Marfan syndrome. Scent autosomal dominant inheritance pattern with variable penetrance. QB Marfan syndrome is caused by a gene mutation in FBN1 on chromosome 15, resulting in defective fibrillin protein. Ehlers-Danlos syndrome I. Mutations in genes, example COL5A1, COL3A1, that control the synthesis and processing of different types of collagen defects, example a defect in lysine hydroxylysine cross-linking of tropocollagen leads to unstable collagen fibrils, autosomal dominant or recessive inheritance with varying patterns of inheritance, severity, and type of collagen-affected scent. Ehlers-Danlos syndrome is subclassified into 13 different types, based on clinical presentation, genetic defect, and type of collagen affected, example hypermobility type, classical type. Only the most common types are discussed here. Types of Ehlers-Danlos syndrome, EDS, J. Hypermobile EDS, most common, classic EDS, classical like EDS, vascular EDS. Genetic enetic defect plus asterisk Khalsa 2 gal TNXBCOL3A1 unknown affected protein asterisk type V collagen asterisk tennyson X scent type ill procollagen. Joint instability, example shoulder and patella dislocations, equals generalized joint hypermobility and predominates. Small joint hypermobility is less joints _ subluxations, example patella, M. Small and large joint hypermobility, prominent than in other EDS types mere Z temporomandibular, shoulder, chronic joint pain premature osteoarthritis. Thin, translucent skin. Hyperextensibility A equals scent easy bruising, hyperextensibility, less severe atrophic scars. 5 a skin. OS asterisk generally milder scent atrophic scars distinguishing compared to classic EDS, asterisk easy bruising features than in asterisk varicoses features poor wound healing classic EDS mild or absent hyperextensibility. Spontaneous arterial aneurysms, cardiovascular asterisk uncommon. Dissections. Spontaneous organ rupture, example colon, gravid uterus, scoliosis. Other characteristic facial features: prominent eyes, thin face and nose, small lips, abdominal hernias, lobeless ears. L and clinical features: back collapse, fine text outline. Clinical features: Marfan syndrome, ISIL 4L. Cardiovascular: Sent aortic disease O caused by aortic necrosis, cystic medial degeneration, weakening of the elastic artery. Copyright manifestations include aortic aneurysm thoracic or abdominal aortic aneurysm, aortic root dilation, aneurysm of the proximal thoracic aorta aortic regurgitation aortic dissection, typically of the thoracic aorta, sent mitral valve prolapse, sent Berry aneurysms, rupture leads to subarachnoid hemorrhage. Musculoskeletal: tall stature and long extremities, joint hypermobility. O positive thumb sign. Marfan disease patients are asked to place their thumbs in the palms of the same hand and then clench to form a fist. A positive thumb sign is present when the thumb protrudes beyond the ulnar border of the hand. Copyright positive wrist sign. Patients are asked to clasp the wrist of the opposite hand. A positive wrist sign is present when the little finger and thumb overlap. High arched palate, arachnodactyly, achromachia, abnormally long, slender fingers and toes. Pectus deformity. Copyright pectus carinatum, a sternal deformity where the middle and lower portion of the sternum protrude forward, also known as sternal kyphosis. O pectus excavatum, a sternal deformity where the middle and lower portion of the sternum protrudes inward. Pes planus, flat foot, or hind foot. Valgus spinal deformities, scoliosis, hyperkyphosis, vertical overdevelopment of the head. Dolichocephaly, winged scapula. Habitual dislocations, particularly the patella and shoulder. Acetabular protrusion. Skin. Sent hyperextensive skin formation of striae, stretch marks. Eyes. Visual impairment, ectopia lentis, lens dislocation, lens subluxation superiorly and temporally. Sent severe myopia. Retinal detachment. Glaucoma. Sent early cataract formation. Other. Sent increased risk of spontaneous pneumothorax. Sent lumbosacral dural ectasia. Add. The classic presentation of MFS includes aortic aneurysm or dissection, long extremities, arachnodactyly, joint hypermobility, and subluxation of the lens of the eye. Ehlers-Danlos syndrome 5. The clinical features discussed here are seen in all types of EDS, but their severity may vary and certain symptoms predominate depending on the specific type. Cardiovascular. Back collapse, fine text outline. Cardiovascular. Heart valve defects, example mitral valve prolapse, sent cystic medial degeneration, can lead to aortic dilation, aneurysms, or dissection. Aneurysm/dissections of the iliac, splenic, or renal arteries. Sent Berry aneurysms, rupture leads to subarachnoid hemorrhage. Musculoskeletal. Plus joint hypermobility with a tendency towards dislocation, sent skeletal abnormalities, example scoliosis, pectus deformity. Sent tendency to bruise easily. Sent skin hyperextensibility. Sent frequent skin lacerations, example with minor scratches, * poor skin healing, example following surgery. Sent atrophic scars. Myopia. Sent retinal detachment and tears. Z. Eyes. Other. Sent hernia. Sent organ rupture, example gravid uterus, causing pain and, potentially life-threatening, internal bleeding, especially seen with vascular EDS. Sent cervical insufficiency, uterine prolapse. Sent dental abnormalities, hypodontia, delayed eruption, molluscoid pseudotumors. Add. The classic presentation of EDS involves hyperextensible skin, joint hypermobility, and a tendency to bleed easily. OOE. Diagnostics. EMFS and EDS are typically clinical diagnoses. MFS and certain types of EDS can be confirmed or ruled out with genetic testing. Sent tests to identify specific manifestations, copyright echocardiography, cardiovascular manifestations, copyright slit lamp examination, to rule out lens abnormalities, copyright imaging, skeletal X-rays and MRI, dural ectasia in Marfan syndrome, registered LL7. Pathology. Sent cystic medial degeneration, a degeneration, necrosis, of large blood vessels such as the aorta. Copyright seen in disorders that cause increased arterial wall stress, example hypertension, coarctation of the aorta, as well as connective tissue disorders, especially MFS and EDS. Copyright can lead to aortic aneurysm and aortic dissection. Copyright histopathology equals loss, thinning, disorganization, and fragmentation of elastic tissue in the media equals accumulation of mucoid extracellular matrix, loss of smooth muscle nuclei. Back collapse. Fine text outline. Differential diagnoses. Differential diagnosis of a Marfanoid body habitus inheritance pattern skeletal dermal vascular other. Asterisk tall stature, increased arm to height ratio, plus arachnodactyly joint hypermobility asterisk scoliosis sent pectus deformity. Aortic root dilation mitral valve prolapse aortic dissection Berry aneurysms. Upward lens dislocation myopia, retinal detachment no intellectual disability. Hyperextensive skin striae Marfan syndrome autosomal dominant. Myopia, retinal detachment organ rupture / prolapse dental abnormalities. Autosomal dominant joint hypermobility or recessive asterisk scoliosis aortic dissection Berry aneurysms hyperextensive skin Ehlers-Danlos syndrome D easy bruising. Plus tall stature downward lens asterisk arachnodactyly dislocation, myopia 7. Asterisk thrombosis homocystinuria sent autosomal recessive scoliosis light skin. Sent intellectual disability, sent arteriosclerosis, 4 pectus deformity megaloblastic anemia osteoporosis seizures. Scoliosis sent pectus deformity. Sent hypertelorism, blue Ciceri 500 congenital heart defects, a Louis-Dietz syndrome 9 sent autosomal dominant copyright cleft palate degree easy bruising, E.G, ASD, abdominal pain, diarrhea sent craniosynostosis B sent organ rupture osteoporosis. Pheochromocytoma Relstonite, inericidium, multiple neurinomas of the lips, medullary THSTATME, plus medullary ROI multiple endocrine autosomal dominant to height ratio, PET_PB sent unaffected, AE neoplasia 2B, MEN 2B, tongue, and lining of the mouth carcinoma arachnodactyly eyes are unaffected. Intestinal atresia, malrotation. Marfan syndrome classically manifests with a superior and temporal displacement of the lens, upward and outward. Homocystinuria also results in a Marfanoid habitus, but manifests with inferior and medial displacement of the lens, downward and inward. The differential diagnoses listed here are not exhaustive. Now are not. Phe, QO. Treatment. Applicable to MFS and EDS. No causal treatment sent interdisciplinary treatment of specific symptoms and manifestations, including, copyright aortic dilatation, beta blockers and, if necessary, aortic root replacement surgery copyright scoliosis, bracing and, if necessary, surgery copyright physical therapy copyright pain, analgesia. Sent regular orthopedic, ophthalmological and cardiological check UPS. Specific treatment 121. Sent Marfan syndrome. Copyright angiotensin receptor blockers, ARBs, can be used in combination with beta blockers to lower blood pressure. Copyright the efficacy of ARBs, example losartan, in preventing aortic root dilation is subject to current research. Sent Ehlers-Danlos syndrome, High contact sports should be avoided and surgical procedures should be performed with caution in order to avoid excessive bruising and internal bleeding. OED. Prognosis. Marfan syndrome, 13I1. Cent normal life expectancy, if diagnosed early and complications are managed appropriately. Cent cardiovascular complications, disease progression should be carefully monitored and managed accordingly to prevent cardiovascular complications, example aortic dissection. Aortic root disease, example aneurysm, dissection, is the most common cause of death. Back collapse. Find text outline. X. Ehlers-Danlos syndrome and Marfan S. Myopia, retinal detachment, organ rupture/prolapse, dental abnormalities. Aortic dissection, Berry aneurysms, autosomal dominant or recessive joint hypermobility, scoliosis, hyperextensive skin, Ehlers-Danlos syndrome, easy bruising. Downward lens arachnodactyly dislocation, myopia, tall stature. Asterisk thrombosis equals homocystinuria, autosomal recessive scoliosis, scent, light skin. Asterisk intellectual disabilities, arteriosclerosis, J plus pectus deformity, asterisk megaloblastic anemia, asterisk osteoporosis, asterisk seizures. Asterisk scoliosis, asterisk pectus deformity, 2 cents hypertelorism, blue slow series 7 underscore asterisk congenital heart defects, 7 Louis Dietz syndrome, 9 asterisk autosomal dominant, copyright cleft palate, scent, easy bruising, ASD, scent, abdominal pain, diarrhea, e.g., asterisk craniosynostosis, 9 asterisk organ rupture, asterisk osteoporosis. Scent, pheochromocytoma, asterisk plastitine, inerentidian degree, multiple neurinomas, S of the lips. Medullary ulth, multiple endocrine, asterisk autosomal dominant to height ratio, PE plus unaffected. OE neoplasia 2B, men 2B, tongue, and lining of the mouth, carcinoma, arachnodactyly, eyes are unaffected. Intestinal atresia, malrotation. Marfan syndrome classically manifests with a superior and temporal displacement of the lens, upward and outward. Homocystinuria also results in a Marfanoid habitus, but manifests with inferior and medial displacement of the lens, downward and inward. The differential diagnoses listed here are not exhaustive. VA. CE. Treatment. Applicable to MFS and EDS. No causal treatment. Scent, interdisciplinary treatment of specific symptoms and manifestations, including copyright aortic dilatation, beta blockers and, if necessary, aortic root replacement surgery, copyright scoliosis, bracing and, if necessary, surgery or physical therapy, copyright pain, analgesia, irregular orthopedic, ophthalmological, and cardiological check, UPS. Specific treatment, 121. Scent, Marfan syndrome, copyright angiotensin receptor blockers, ARBs, can be used in combination with beta blockers to lower blood pressure. Copyright the efficacy of ARBs, example losartan, in preventing aortic root dilation is subject to current research. Scent, Ehlers-Danlos syndrome, high contact sports should be avoided and surgical procedures should be performed with caution in order to avoid excessive bruising and internal bleeding. Or prognosis. Marfan syndrome, 131I1. Scent, normal life expectancy, if diagnosed early and complications are managed appropriately. Scent, cardiovascular complications, disease progression should be carefully monitored and managed accordingly to prevent cardiovascular complications, example aortic dissection. Aortic root disease, example aneurysm, dissection, is the most common cause of death. Ehlers-Danlos syndrome, 7-14I15. Scent, normal life expectancy in all types of EDS except vascular type. Scent, life expectancy in vascular type, approximate 50 years. Back collapse. Find text outline. Ehlers-Danlos syndrome and Marfan syndrome, 1/1. Marfan syndrome, tall stature. Epidemiology, prevalence 1-5/10.000. Berry aneurysms. High arched palate, ectopia lentis, JTHWV. Etiology, severe myopia, AE mutation of fibrillin 1 gene, heart valve defects, FBN1, on chromosome 15, autosomal dominant inheritance. Pectus deformity, pectus carinatum. A complications or pectus excavatum, primarily cardiovascular aortic disease, example aortic dissections, example aortic dissection. Aortic aneurysm / spinal deformities. Life expectancy I can be normal, given timely / ww diagnosis and appropriate ROMs. AAA management, cardiological check UPS, TEAE / scoliosis, hyperkyphosis. Arachnodactyly, F1 vs joint hypermobility HJ. Long extremities. Hyperextensive skin. Pes planus, hindfoot valgus. Marfan syndrome fact sheet VV. Copyright Emboss. Ehlers-Danlos syndrome and Marfan syndrome, 1/8. Marfan syndrome. This photograph of a 15-year-old girl shows long extremities, arachnodactyly, a winged right scapula, left side scoliosis, right pelvic tilt, and shortening of the right leg. These are characteristic features of Marfan syndrome. Source, copyright IMPP. Ehlers-Danlos syndrome and Marfan syndrome, 2/8. Joint hypermobility VV. The first interphalangeal joint is able to be extended to an abnormal degree. Joint hypermobility is a typical feature of connective tissue disorders such as Ehlers-Danlos syndrome and Marfan syndrome. Source, Ehlers-Danlos thumb by Piotr.Zonek, Wikimedia Commons, licensed under CC by SA 4.0. Ehlers-Danlos syndrome and Marfan syndrome, 3/8. Arachnodactyly in Marfan syndrome VV. Female patient with an asthenic body habitus and long, slender fingers, arachnodactyly. Source, copyright IMPP. Ehlers-Danlos syndrome and Marfan syndrome, 4/8. Pectus carinatum. The middle and lower portion of the sternum protrudes forward, resulting in a distinct deformity of the chest wall. Source, Figure 6, in Hutchinson-Gilford progeria syndrome, a rare genetic disorder by Rajith G. Panigrahi, Antarmati Panigrahi, Purnima. Vijayakumar et.al., Case Reports in Dentistry, licensed under CC by 3.0. Modifications, image censored by addition of a black box over eyes. Overlay. Lens subluxation in Marfan syndrome VV. Slit lamp photography in the upper part of the pupil, indicated by green outline, the subluxated lens is visible, indicated by green overlay. The part of the lens that is located behind the iris and therefore not visible is indicated by the hatched overlay. Additionally, the yellow-brown color of the lens indicates cataract. Superior or temporal lens subluxation is a major criterion for the diagnosis of Marfan syndrome and occurs in the majority of the affected individuals. Source, copyright IMPP. Ehlers-Danlos syndrome and Marfan syndrome, 5/8. Copyright. Overlay. Lens subluxation in Marfan syndrome VV. Slit lamp photography in the upper part of the pupil, indicated by green outline, the subluxated lens is visible, indicated by green overlay. The part of the lens that is located behind the iris and therefore not visible is indicated by the hatched overlay. Additionally, the yellow-brown color of the lens indicates cataract. Superior or temporal lens subluxation is a major criterion for the diagnosis of Marfan syndrome and occurs in the majority of the affected individuals. Source, copyright IMPP. Ehlers-Danlos syndrome and Marfan syndrome, 6/8. Overlay. Retinal detachment in Marfan syndrome. Fundus photography. A giant tear, blue overlay, with rolled margins, hatched overlay, the arrows show the path along which the retina has rolled up, is visible. The giant tear has caused retinal detachment, yellow overlay, the detached portion of the retina appears brighter than the attached portion of the retina. The risk for retinal detachment is elevated in individuals with Marfan syndrome. Source: Copyright IMPP. Ehlers-Danlos syndrome and Marfan syndrome, 6/8. Copyright. Overlay. Retinal detachment in Marfan syndrome. Fundus photography. A giant tear, blue overlay, with rolled margins, hatched overlay, the arrows show the path along which the retina has rolled up, is visible. The giant tear has caused retinal detachment, yellow overlay, the detached portion of the retina appears brighter than the attached portion of the retina. The risk for retinal detachment is elevated in individuals with Marfan syndrome. Source: Copyright IMPP. Ehlers-Danlos syndrome and Marfan syndrome, 7/8. Facial features of Ehlers-Danlos syndrome. 4. Photographs of two patients with the genetic disorder Ehlers-Danlos syndrome are shown. Both patients have prominent eyes, a thin face with sunken cheeks, and small lips, due to reduced subcutaneous fat tissue. The patient on the right has lobeless ears, which are a common sign of this condition. Source: Fig. 1, in Hereditary Connective Tissue Diseases in Young Adult Stroke, a comprehensive synthesis by Vanacker O.M., Hamelso at D. de PPA, Hindawi, licensed under CC by 3.0. Modifications: image cropped. Ehlers-Danlos syndrome and Marfan syndrome, 8/8. Skin hyperextensibility in Ehlers-Danlos syndrome VV. The skin of the elbow is hyperelastic, cutis hyperelastica, due to impaired collagen synthesis. This, along with joint hypermobility, is a characteristic feature of Ehlers-Danlos syndrome. Source: Copyright IMPP. Ehlers-Danlos syndrome and Marfan syndrome, 1/1. Cystic medial degeneration, cystic medial necrosis, VV. Photomicrograph of a large vessel displaying cystic medial degeneration, Mouavit stain, the tunica media, upper layer, shows large amounts of a basophilic ground substance, blue stains. The elastic fibers in this area are disrupted. Additionally, vasa vasorum are shown in the tunica adventitia, yellow layer at the bottom of the image. Source: Cystic medial degeneration, Mouavit, Intermed Mag JPG by Nephron, Wikimedia Commons, licensed under CC by SA 3.0. XX neurocutaneous syndromes. Neurocutaneous syndromes, phacomatoses, are a diverse class of congenital disorders that affect organs of ectodermal origin, especially the skin, the central nervous system, and the eyes. The disorders most typically included in this class are neurofibromatosis type 1, NF type 1, von Recklinghausen syndrome, neurofibromatosis type 2, NF type 2, tuberous sclerosis, von Hippel-Lindau syndrome, Sturge-Weber syndrome, and ataxia-telangiectasia. With the exception of Sturge-Weber syndrome, which is caused by a non-inherited developmental anomaly of neural crest derivatives, and ataxia-telangiectasia, which follows an autosomal recessive inheritance pattern, neurocutaneous syndromes disorders follow an autosomal dominant inheritance pattern, although spontaneous mutations are also possible. Characteristic features include neurofibromas, café au lait spots, axillary freckling, pheochromocytoma, optic glioma, and Lisk nodules, NF1, bilateral vestibular schwannomas, meningiomas, ependymomas, and bilateral cataracts, NF2, adenoma sebaceum, ash leaf spots, shagreen patch, giant cell astrocytoma, cardiac rhabdomyoma, and renal angiomyolipoma, tuberous sclerosis, hemangioblastoma, angiomatosis, bilateral renal cell carcinoma, pheochromocytoma, von Hippel-Lindau syndrome, port wine stain and leptomeningeal angioma, Sturge-Weber syndrome, spider angioma, lymphoma, leukemia, gastric carcinoma, and ocular telangiectasia, ataxia telangiectasia. Diagnosis is based on clinical findings and is confirmed by genetic testing. Since there is no curative treatment, the management of neurocutaneous syndromes is symptom-oriented. OS. RO, ISIS. Overview. Overview of neurocutaneous syndromes. Cause: main features: disorder, inheritance, mutation, skin changes, common tumors, other features. Multiple neurofibromas degree. Autosomal cafe au lait spots MSAES. We neurofibromatosis type 1, cent NF1 gene on chromosome 17%, optic glioma cent Lisk nodules dominant cent axillaris/inguinal freckling pheochromocytoma. Cent bilateral vestibular schwannoma autosomal cafe au lait spot 7, neurofibromatosis type 2, NF2 gene on chromosome 22 meningioma cent bilateral cataracts dominant, nonspecific, cent ependymoma. Cent ash leaf spots TSC1 gene on chromosome 9F giant cell astrocytoma. Autosomal shagreen patch, cent infantile spasms tuberous sclerosis, TSC2 gene on chromosome cardiac rhabdomyoma S dominant I adenoma sebaceum cent intellectual disability 16. Cent renal angiomyolipoma ungual fibromus. Cent retinal and CNS hemangioblastoma Hippel-Lee autosomal AA renal cysts von Hippel-Lindau, VHL gene on chromosome 3 uncommon. US equals syndrome dominant cent bilateral renal cell carcinoma pancreatic cysts pheochromocytoma. Seizures intellectual disability Sturge-Weber syndrome somatic mutation in GNAQ not inherited port wine stain leptomeningeal angioma me gene. Stroke-like episodes. Ocular telangiectasia lymphoma autosomal AS, ataxia telangiectasia, ATM gene spider angioma leukemia recessive OO, cent cerebellar ataxia gastric carcinoma IgA deficiency. WA. OES. Neurofibromatosis. Epidemiology. Cent incidence. Neurofibromatosis type 1, 1:2,500-3,000 HL. Copyright neurofibromatosis type 2, 133,000, 2. Etiology. Neurofibromatosis type 1 and type 2, autosomal dominant inheritance or spontaneous mutation. Pathophysiology. Back collapse fine text outline. Pathophysiology. Cent mutation of tumor suppressor gene loss of function uninhibited cell growth neurofibroma development ONF type 1, NF1 gene mutation, 100% penetrance, equals encodes neurofibromin protein equals located on chromosome 17 equals inhibition of cell growth and proliferation via inhibition of the RAS signal transduction pathway. RAS activity is inhibited by the stimulation of GT-PASE, ONF type 2, NF2 gene mutation equals encodes Merlin protein equals located on chromosome 22 clinical features. Neurofibromatosis type 1, von Recklinghausen syndrome, 3. Multiple neurofibromas, benign peripheral nerve sheath tumors that originate from neural crest cells and affect the myelinated nerves. NA copyright soft, painless nodules, typically manifest under or on the skin. Age of onset, adolescence. Malignant transformation possible. Scent features due to melanocyte dysfunction. Cafe au lait spots equals brown, hyperpigmented, flat macule or patch equals age of onset, before 2 years. Copyright Lisk nodules equals pigmented iris. Hamartomas equals age of onset, between 5 to 10 years. Copyright axillary and inguinal freckling, Age of onset is between 3 to 5 years. Scent seizures and / or focal neurologic signs due to brain lesions, especially meningiomas. Scent intellectual disability. Scent bone involvement. Copyright scoliosis. Copyright sphenoid wing dysplasia. O short stature. Copyright cortical thinning. O fractures. O pseudoarthrosis. E additional findings. O associated with certain tumors. Pheochromocytoma 41. Nephroblastoma 5 equals optic pathway glioma, most commonly involving optic nerve, causing unilateral vision loss, proptosis, or precocious puberty. Eomacrocephaly. O hypertension. Eopulmonary stenosis. QB think cafe spots. To remember features of NF type 1, cafe au lait spots, axillary freckling, neurofibromas, nodules in the eye, skeletal abnormalities, example scoliosis, high blood pressure, optic tumor, stature, usually short. Neurofibromatosis type 2, 6. Age of symptom onset, between 18 to 24 years. 2. Scent bilateral vestibular schwannomas, acoustic neuromas, copyright located in the internal acoustic meatus, affecting the vestibulocochlear nerve. Copyright can cause tinnitus, hearing loss, or vertigo. Scent early onset cataracts, usually bilateral. Scent multiple cerebral and spinal tumors, especially meningiomas and ependymomas. 7. Scent other features, seizures, skin nodules, and / or cafe au lait spots, not specific for NF type 2. Back collapse. Fine text outline. And in NF type 2, the mutation is in chromosome 20-2 and the clinical findings, schwannoma and cataracts, manifest on two sides. Diagnostics. Scent MRI of the brain and spine with contrast, to detect example neurofibromas, meningiomas. Scent ophthalmological exam, to detect optic glioma in NF type 1. Auditory testing, to detect acoustic neuromas in NF type 2. Scent genetic testing, mutations in NF1 gene or NF2 gene. Differential diagnosis. Scent cafe au lait spots. O McCune-Albright syndrome. Copyright Fanconi anemia. Copyright tuberous sclerosis. O ataxia telangiectasia. O Noonan syndrome. O Bloom syndrome is equals etiology, mutations in the BLM gene. Deficient helicase enzyme equals clinical features equals short stature equals skin rash, butterfly shaped on nose and cheeks, photosensitive, telangiectasia of hands and arms. Cafe au lait spots equals increased risk of cancer, example leukemia. Scent schwannoma. O schwannomatosis, copyright sporadic. Vestibular schwannoma for treatment. Scent excision or resection of tumors, example meningiomas. Scent surgery for kyphoscoliosis in NF type 1. Scent drugs targeting the mTOR pathway, example sirolimus, to reduce tumor growth. Prognosis. Increased mortality due to malignant transformation of tumors. Average life expectancy. NF type 1, 60 years. 2. NF type 2, 40 years. 0 LL11. AO. FO, CES. Tuberous sclerosis. Epidemiology. Plus incidence is 1:6,000, 121. Etiology. Autosomal dominant inheritance or spontaneous mutation. Pathophysiology. Mutation of tumor suppressor genes, variable expression, loss of function. Unchecked cell growth. Tumor development. Tumor suppressor genes. OTSC1 gene on chromosome 9 encodes Hamartin protein. OTSC2 gene on chromosome 16 encodes tuberin protein. Clinical features 131,141. Intellectual disability, caused by brain lesions. Scent infantile spasms. Copyright occur in children. Back collapse. Fine text. A. Outline. O adenoma sebaceum, facial angiofibroma. Benign tumor composed of blood vessels and fibrous connective tissue. Equals age of onset, between 3 to 4 years of age. Development of lesions increases during adolescence. Equals features mostly located around the nose and cheeks. Distribution resembles a butterfly shape. Equals can have an acne-like appearance. Ash leaf spots, hypopigmented, white, macules on the trunk and extremities. Equals age of onset, present since birth equals 3 or more spots are diagnostic equals visualized using black light emitted by a wood lamp copyright shagreen patch, flesh-colored papule in the lumbosacral region with an orange peel appearance MSO skin hamartomas copyright ungual fibromas, flesh-colored papules that grow under, subungual, or around the nails, periungual, 2 cent small benign tumors O brain tumors equals hamartomas, can be cortical, glioneuronal hamartoma or tuber, subcortical, and slash or subependymal. Equals giant cell astrocytoma. Equals benign, slow-growing tumor of mixed glial cells that is associated with tuberous sclerosis. Equals typically arises in periventricular areas and, if symptomatic, presents subacutely with evidence of obstructive hydrocephalus, example headache, papilledema, O cardiac rhabdomyoma equals present in 50% of affected individuals may cause symptoms of mitral regurgitation and slash or congestive heart failure O renal disease, may manifest with a feeling of abdominal fullness and slash or macrohematuria equals renal cysts angiomyolipoma asterisk renal carcinoma, 15. Q at hamartomas, hamartomas, ash leaf spots, mind, intellectual disability, adenoma sebaceum, renal angiomyolipoma, rhabdomyoma, tumor suppressor genes, TSC1 gene and TSC2 gene, autosomal dominant, mitral regurgitation, astrocytomas, seizures, and shagreen patches. YPAE AN3 Pi equals Diagnostics, 16. EECG, cardiac rhabdomyoma can cause ventricular hypertrophy and arrhythmias sent EEG, seizure activity sent imaging copyright echocardiography, rhabdomyoma, common in the apex of the left ventricle, copyright abdominal MRI, renal cyst, angiomyolipoma, and slash or carcinoma. Copyright contrast cerebral CT/MRI tumors, example giant cell astrocytomas, equals enlarged ventricles, tumors in the periventricular area commonly cause obstructive hydrocephalus, sent genetic testing, mutation of TSC1 or TSC2 gene. Differential diagnosis. Sent conditions associated with ash leaf spots O nevus anemicus OE hypomelanosis of ITO degree vitiligo copyright piebaldism sent conditions associated with angiofibroma copyright Birt-Hogg-Dubs syndrome EOMEN1 syndrome sent conditions associated with shagreen patch copyright Birt-Hogg-Dubs syndrome OMEN1 syndrome sent other hamartoma syndromes copyright Cowden syndrome O juvenile polyposis syndrome O Putz-Jaher's syndrome. Back collapse fine text outline. Sent other hamartoma syndromes copyright Cowden syndrome E juvenile polyposis syndrome O Putz-Jaher's syndrome copyright Gorlin syndrome. Treatment, 161. Sent seizure control copyright infantile spasms, vigabatrin or ACTH copyright anticonvulsants sent mTOR inhibitors, to treat renal angiomyolipoma and inoperable giant cell astrocytoma sent removal of angiofibroma, laser treatment or electrosurgery, sent surgery in the case of, copyright obstructive hydrocephalus, with TICP, O drug-resistant seizures. Prognosis, 171. Sent renal disease and epilepsy are the most common causes of death. Sent life expectancy depends on severity of disease but can be normal if symptoms are mild and complications are treated accordingly. VA CE Von Hippel-Lindau syndrome. Epidemiology. Asterisk incidence, 136,000,8. Etiology. Sent autosomal dominant inheritance or spontaneous mutation pathophysiology. Sent VHL gene, tumor suppressor gene on the short arm of chromosome 30 encodes VHL protein, PVHL, copyright deletion of VHL gene impaired ubiquitination and elimination of hypoxia-inducible factor 1AJ loss of function tumor and cyst development. Clinical features 191I20. Characterized by the development of numerous benign and malignant tumors, vascular tumors, hemangioblastoma or angiomatosis, copyright common in retina, cerebellum, brainstem, and/or spine. Copyright can cause vision loss or focal neurological deficits. Hemangioblastomas are highly vascularized lesions whose cells have hyperchromatic nuclei. Bilateral renal cell carcinoma can cause flank pain, hematuria, and/or renal dysfunction. Pheochromocytoma can cause episodic hypertension with paroxysmal headaches, palpitations, and/or diaphoresis. Renal, pancreatic, and/or adrenal cysts. Endolymphatic sac tumor or bilateral disease is a pathognomonic feature. Copyright can cause hearing loss, tinnitus, and/or vertigo. Cystadenoma, located in the broad ligament or epididymis. Von Hippel-Lindau syndrome, hemangioblastoma, increased risk of renal cell carcinoma, pheochromocytoma, pancreatic lesions, cysts, cystadenomas, and neuroendocrine tumors, eye lesions, retinal angiomas or hemangioblastomas. Diagnostics 20LL21. Sent laboratory studies O-bun and/or creatine to rule out renal impairment. Copyright plasma catecholamines and urinary catecholamine metabolites to screen for pheochromocytoma. Sent fundoscopic eye exam, retinal hemangioblastoma IPA. Sent imaging. Copyright abdominal ultrasound, CT, or MRI, to detect renal cell carcinoma and renal/pancreatic cysts. 1. Copyright CT/MRI of the brain and spine, to detect hemangioblastoma. A. Back collapse. Fine text outline. E-imaging. Copyright abdominal ultrasound, CT, or MRI, to detect renal cell carcinoma and renal/pancreatic cysts. Copyright CT/MRI of the brain and spine, to detect hemangioblastoma. OCT/MRI of internal auditory canal, endolymphatic sac tumors. E-audiogram, endolymphatic sac tumors /E genetic testing, mutations in VHL gene. Differential diagnosis. E familial pheochromocytoma syndromes. OMEN2 syndrome. Copyright neurofibromatosis type 1. E hereditary paraganglioma. Pheochromocytoma syndrome. E renal and pancreatic cysts, autosomal dominant polycystic kidney disease. Treatment 22. Mainly consists of regular surveillance and, if necessary, surgical treatment of tumors. E retinal or CNS hemangioblastoma, resection. E renal cell carcinoma, nephrectomy or radiofrequency ablation. Copyright alternative to surgery, antiangiogenic medications, example receptor tyrosine kinase inhibitors such as sunitinib. E pheochromocytoma, resection. Prognosis 23. CNS hemangioblastoma is the main cause of death. Average life expectancy, 60 years for women and 67 years for men. OOAO. Sturge-Weber syndrome. 2. Epidemiology. Asterisk incidence, 1:50,00024. Etiology. Sent congenital non-inherited developmental anomaly of neural crest derivatives. Pathophysiology. Asterisk somatic mosaic mutation of GNAQ gene, asterisk gain of function mutation in one copy of gene. Malformation of capillaries. Clinical features 25. Vascular malformations involving the following: degree skin, port wine stain, nevus flammeus. Copyright non-neoplastic birthmark. Copyright commonly seen in the CNV1 and CNV2 dermatomes of the face. Copyright typically unilateral. ECNSO leptomeningeal angioma, benign vascular tumor involving the arachnoid and pia mater, leptomeninges, equals ipsilateral to port wine stain equals commonly involves the parietal or occipital lobes equals atrophy and calcifications in the cerebral cortex underlying the tumor. Copyright seizures / epilepsy o intellectual disability oe recurrent stroke-like episodes, manifests with hemianopia or hemiparesis plus I, episcleral angioma, causing TIOP and early onset glaucoma. 261. Back collapse. Fine text. Outline. And Sturge-Weber, sporadic, port wine stain, tram track calcifications, unilateral, recurrent strokes or seizures, glaucoma, GNAQ gene, epilepsy. Diagnostics. Eye exam, IOP measurement to rule out glaucoma EEG, to detect seizure activity scent imaging copyright CT or skull radiograph, gyriform, curvilinear, parallel opacities with a tram track appearance MRI of the brain with contrast, enhancement of leptomeningeal angiomas angiography, to detect abnormal vessel structure scent genetic testing, mutation in GNAQ gene scent CSF analysis, elevated protein in case of secondary microhemorrhage. Differential diagnosis. Port wine stain, Klippel-Trenaunay syndrome treatment. Scent seizure control, anticonvulsants or surgery. Glaucoma management, see treatment in glaucoma. Pulsed laser therapy for removal of port wine stain. Low-dose aspirin to prevent stroke-like episodes. 27 Prognosis 28-29. Severity of the disease depends on extent of skin and brain involvement. Age of onset of seizures. Life expectancy is normal. WA 05. Ataxia telangiectasia. Epidemiology. Asterisk incidence is 1:100,0008 degrees. Etiology. Autosomal recessive inheritance. Pathophysiology. ATM gene mutation defective dsDNA break repair accumulation of mutations tumor development and immunodeficiency, combined B and T cell immunodeficiency, clinical features 311. Scent neurological features copyright cerebellar involvement equals age of onset, 6 to 18 months equals atrophy of the cerebellar vermis and hemispheres equals symptoms equals truncal swaying equals gait ataxia equals dyssynergia equals muscle hypotonia equals sudden falls movement abnormalities equals chorea athetosis. Back collapse. Find text outline. Movement abnormalities equals chorea athetosis dystonia equals myoclonic jerks eye involvement equals oculomotor apraxia equals nystagmus equals strabismus plus spider angiomas, telangiectasia that mainly involves the conjunctiva and face 1 scent immunodeficiency, B and T cell deficiency, manifests with recurrent sinopulmonary infections copyright commonly associated with IgA deficiency, example mucosal infection, transfusion-related anaphylaxis, OTAFP scent increased risk of malignancy lymphoma. Leukemia degree gastric carcinoma. And the 4 A's of ataxia telangiectasia, ATM gene, ataxia, spider angiomas, and IgA deficiency. Avoid X-ray exposure because of high sensitivity to radiation and increased risk of malignancy. Diagnostics. Scent serology foot AFPC2/2LLS3, IgA, IgG, and IgE lymphopenia genetic testing, mutation of ATM gene scent contrast MRI, may show cerebellar atrophy. Differential diagnosis 31. Scent cerebral palsy Friedreich ataxia ataxia telangiectasia-like disorder type 2 ataxia with oculomotor apraxia type 1 ataxia with oculomotor apraxia type 2 Riddle syndrome Niemann-Pick disease Gaucher disease. Treatment. Antibiotic therapy, for acute infection and/or prophylaxis scent IV immunoglobulin therapy, depending on the severity of Ig deficiency. Prognosis. Scent variable rate of progression scent affected individuals typically require a wheelchair by adolescence. Scent malignancy is the most common cause of death. 34 plus average life expectancy, 25 years of age 35. Sources. Last updated April 18, 2023. V. Back collapse. A. Find text outline. Feedback. Neuroneurocutaneous syndromes, 13/16. Sturge-Weber syndrome. Definition: congenital, non-inherited vascular disorder caused by somatic mosaic mutation of GNAQ gene. Pathophysiology: mutation of GNAQ gene, abnormal embryonal developmental of neural crest derivatives, capillary malformations. Diagnosis: at MRI/CT scan, tram track appearance of leptomeningeal calcifications at increased intraocular pressure. Treatment: symptomatic. Sturge-Weber syndrome fact sheet. Copyright Emboss. Port wine stain, nevus flammeus. CNS. Leptomeningeal vascular malformations, leading to seizures may. Intellectual disability. Co. Stroke-like episodes, example hemianopia, hemiparesis. Port wine stain, nevus flammeus. A sharply demarcated, irregularly configured, erythematous area with a smooth surface on the left side of this 2-month-old infant's face is visible. Image source of original image, www.pediatry-in-builder-n.de. Created by Dr. Thomas Rotten-Strock. Modifications to original image, anonymized. Neurocutaneous syndromes, 15/16. Ataxia telangiectasia VV. Medial angle of the left eye showing severely dilated blood vessels on the conjunctiva, conjunctival telangiectasia. Conjunctival telangiectasias are a clinical finding of ataxia telangiectasia, Lewis-Barr syndrome, a rare neurocutaneous syndrome. Source: Ataxia telangiectasia, National Eye Institute, Wikimedia Commons licensed under public domain. Neurocutaneous syndromes, 16/16. 256 degree 320 VO, COR, -1.0. Ocular and cerebral manifestations in ataxia telangiectasia VV. Image A, close-up photograph of the left eye while the patient is looking to the right. Top: a significantly dilated vessel of the conjunctiva can be seen. Apart from that, the prominent epicanthic fold suggests an Asian background of the patient. Image B, cranial MRI, T1W, sagittal view. A remarkable atrophy of the cerebellum can be noted, leading to secondary enlargement of the cerebrospinal fluid system. When put together, both findings are characteristics of neurocutaneous syndrome, ataxia telangiectasia, Lewis-Barr syndrome. Source: Figure 1, the clinical features of an ET patient by Zhao Chen, Wei Ye, Zhelong et al., +1, licensed under CC by 4.0. Neurocutaneous syndromes, 12/16. Retinal hemangioblastoma in von Hippel-Lindau disease. Fundus photography of a left eye adjacent nasally to the optic disc, a sharply demarcated orange lesion is visible. This is the typical appearance of a retinal hemangioblastoma. Approximate 50% of patients with a solitary lesion will have von Hippel-Lindau disease. The vast majority of patients with multiple lesions will have von Hippel-Lindau disease. By Shida Chen, Emily Y. Chu and Chi Chao Chan, Journal of Medical Case Reports, Biomed Central, licensed under CC by 4.0. Modifications: image cropped and removal of the letter B. Overlay. Hemangioblastomas of the central nervous system in von Hippel-Lindau syndrome VV. MRI images, contrast enhanced, T1 weighted, of a patient with von Hippel-Lindau syndrome. Image A, brain, axial view, shows a tumor within the lateral aspect of the right cerebellum. It consists of an enhancing solid component, red overlay, and a larger, hypointense part representing a cystic component, blue overlay. Image B, brain, sagittal view, shows a contrast-enhancing tumor, green overlay, between medulla oblongata and cerebellum, within the region of the foramen of Magendie/median aperture. Image C, spine MRI, sagittal view, shows a hyperintense tumor, yellow overlay, within the dorsal/posterior spinal canal at the level of vertebra C5-C6. Von Hippel-Lindau syndrome is a hereditary disorder characterized by the development of tumors in multiple parts of the body. This includes hemangioblastomas of the central nervous system, such as in this example. Hemangioblastomas are highly vascular tumors, resulting in the intense enhancement demonstrated on these post-contrast images. Peritumoral cysts are uroneurocutaneous syndromes, 11/16. Overlay. Hemangioblastomas of the central nervous system in von Hippel-Lindau syndrome VV. Image A, brain, axial view, shows a tumor within the lateral aspect of the right cerebellum. It consists of an enhancing solid component, red overlay, and a larger, hypointense part representing a cystic component, blue overlay. Image B, brain, sagittal view, shows a contrast-enhancing tumor, green overlay, between medulla oblongata and cerebellum, within the region of the foramen of Magendie/median aperture. Image C, spine MRI, sagittal view, shows a hyperintense tumor, yellow overlay, within the dorsal/posterior spinal canal at the level of vertebra C5-C6. Von Hippel-Lindau syndrome is a hereditary disorder characterized by the development of tumors in multiple parts of the body. This includes hemangioblastomas of the central nervous system, such as in this example. Hemangioblastomas are highly vascular tumors, resulting in the intense enhancement demonstrated on these post-contrast images. Peritumoral cysts are common in these tumors, and result from plasma ultrainfiltrate passing through the permeable tumor blood vessels. Acol-linium. Overlay. Large angiomyolipoma associated with tuberous sclerosis T2 weighted MRI of the abdomen with gadolinium-based contrast medium, frontal section, large angiomyolipoma of the left kidney, K, associated with tuberous sclerosis, L equals liver, S equals spleen, source, copyright IMPP. Plus coli WEM copyright overlay. Large angiomyolipoma associated with tuberous sclerosis T2 weighted MRI of the abdomen with gadolinium-based contrast medium, frontal section, large angiomyolipoma of the left kidney, K, associated with tuberous sclerosis, L equals liver, S equals spleen, source, copyright IMPP. And neurocutaneous syndromes, 9/16. Ungual fibromas. Multiple fleshy papular lesions are visible on this patient's nail beds, causing localized damage to the nail and impairing nail growth. This is a typical finding in tuberous sclerosis. Source, Figure 3, in Frequent Falls and Confusion, Recurrent Hypoglycemia in a Patient with Tuberous Sclerosis Complex by Alexander N. Cominos, Lisa Yang, Ali Ibarra, Waljit Estilo, J.H. Duncan Bassett, Jeannie F. Todd, Clinical Case Reports, licensed under CC by 4.0. Neurocutaneous syndromes, 8/16. Adenoma sebaceum in patient with tuberous sclerosis VV. Multiple papules, resembling acne, can be seen on this patient's face. These findings are suggestive of adenoma sebaceum, a cutaneous condition in patients with tuberous sclerosis characterized by the presence of angiofibromas. Source, a case of tuberous sclerosis showing facial angiofibromas in characteristic butterfly pattern by Herbert L. Fred MD and Hendrik A. van Dijk, Wikimedia Commons, licensed under CC by SA 3.0. Uroneurocutaneous syndromes, 7/16. Shagreen patch yen. Photograph of the back of a patient with tuberous sclerosis complex. A flesh-colored, irregularly shaped, slightly elevated patch can be seen on this patient's lumbosacral region. The fibrotic tissue gives it a bumpy appearance, which is often compared to that of orange peel. Source, Figure 1, in Brain Proteomic Profiling in Intractable Epilepsy Caused by TSC1 Truncating Mutations, a small sample study by Lu Y.D., Ma M.Y., Hu X.B., Yan H., Zhang Y.K., Yang H.X., Feng J.H., Wang L., Zhang H., Zhang B., Li QB, Zhang JC and Kong QX, Frontiers in Neurology, licensed under CC by 4.0. Modifications, image is cropped. And neurocutaneous syndromes, 6/16. Overlay. Ash leaf spots VV4 ellipsoid, hypopigmented macules, ash leaf spots, are located on the back of the patient, green overlay. The presence of more than 3 ash leaf spots is characteristic of tuberous sclerosis. Source, courtesy of Dr. Gary M. White MD. And neurocutaneous syndromes, 6/16. Copyright overlay. Ash leaf spots VV4 ellipsoid, hypopigmented macules, ash leaf spots, are located on the back of the patient, green overlay. The presence of more than 3 ash leaf spots is characteristic of tuberous sclerosis. Source, courtesy of Dr. Gary M. White MD. Neurocutaneous syndromes, 5/16. Overlay. Vestibular schwannomas and parasagittal meningioma VV. MRI head, T1 weighted, with contrast, A. Axial plane, B. Coronal plane, of a patient with neurofibromatosis type 2, NF2, the bilateral contrast-enhancing cerebellopontine angle masses, green overlay, represent vestibular schwannomas. The parasagittal location of the third intracranial mass, red overlay, suggests that it is a meningioma. Bilateral vestibular schwannomas are the hallmark feature of NF2. Many patients also develop meningiomas and other tumors of the central nervous system. Source, Figure 1 in, Magnetic Resonance Findings of Neurofibromatosis Type 2, a case report by Gabriela Spielberg et al., Cases Journal, licensed under CC by 2.0. Neurocutaneous syndromes, 5/16. Copyright. Overlay. Vestibular schwannomas and parasagittal meningioma VV. MRI head, T1 weighted, with contrast, A. Axial plane, B. Coronal plane, of a patient with neurofibromatosis type 2, NF2, the bilateral contrast-enhancing cerebellopontine angle masses, green overlay, represent vestibular schwannomas. The parasagittal location of the third intracranial mass, red overlay, suggests that it is a meningioma. Bilateral vestibular schwannomas are the hallmark feature of NF2. Many patients also develop meningiomas and other tumors of the central nervous system. Source, Figure 1 in, Magnetic Resonance Findings of Neurofibromatosis Type 2, a case report by Gabriela Spielberg et al., Cases Journal, licensed under CC by 2.0. Father-son. Lisk nodules VV right eyes of a father and son, multiple brown-yellow, well-defined, and partly confluent papules, hamartomas, are visible on the iris. These lesions are called Lisk nodules and can be seen in the vast majority of individuals with neurofibromatosis. Source, copyright IMPP. Neurofibromas. Multiple papules and nodules of varying sizes located on the upper back. Numerous neurofibromas are pathognomonic of neurofibromatosis type 1, von Recklinghausen disease. Source, copyright IMPP. Neurocutaneous syndromes, 2/16. Neurofibromatosis type. Multiple nodules of different sizes, neurofibromas, are visible in images, A and B. Light brown macules with irregular borders and a diameter over 15 mm, café au lait spots, are visible on the extremities shown in images, C and D. These are possible findings of neurofibromatosis type I. Source, a rare combination of pheochromocytoma and gastrointestinal stromal tumor in a patient with neurofibromatosis 1 syndrome, a case report by Jayalakshmi P.S., Mohan A., Kumar R.K., ETAL, surgical case reports, licensed under CC by 4.0. Neurocutaneous syndromes, 1/16. Neurofibromatosis type 1. Multiple light brown macules with irregular borders, café au lait spots, are visible on the upper left arm, shoulder, and back. This presence of multiple café au lait spots is highly suggestive of neurofibromatosis type 1. Source: courtesy of Dr. Gary M. White MD. Neuroneurocutaneous syndromes, 1/9. Neurofibromatosis type 1, neurofibromatosis type 2. Associated tumors, features of melanocyte dysfunction, associated tumors, I meningiomas. AP. Optic glioma, early onset bilateral cataract, Lisk nodules, bilateral vestibular schwannoma, tinnitus, hearing loss, vertigo, axillary and inguinal freckling, spinal tumors, example ependymomas, multiple café au lait spots, pheochromocytoma, skin nodules, example schwannomas. Bone involvement, etiology, scoliosis, bone dysplasia, multiple neurofibromas. Clinical features of neurofibromatosis type 1 and type 2 VV. Neurofibromatosis are autosomal dominant inherited neurocutaneous syndromes that are caused by mutations in tumor suppressor genes. Neurofibromatosis type 1 has a typical onset in adolescence and manifests with multiple neurofibromas, benign peripheral nerve sheath tumors that originate from neural crest cells. Neurofibromatosis type 2 has a later onset in early adulthood and manifests with multiple cerebral and spinal tumors. Copyright Emboss. Neurofibromatosis type 1, von Recklinghausen disease. Multiple neurofibromas, soft, painless nodules, are visible on the neck, back, and upper limbs of this 16-year-old patient. A. Café au lait macule, light brown, hyperpigmented patch, can be seen below the inferior angle of the left scapula. Source: copyright IMPP. Neurocutaneous syndromes, 4/9. Neurofibromatosis type. Multiple nodules of different sizes, neurofibromas, are visible in images A and B. Light brown macules with irregular borders and a diameter over 15 mm, café au lait spots, are visible on the extremities shown in images C and D. These are possible findings of neurofibromatosis type I. Source: a rare combination of pheochromocytoma and gastrointestinal stromal tumor in a patient with neurofibromatosis 1 syndrome. A case report by Jayalakshmi P.S., Mohan A., Kumar R.K., ETAL, surgical case reports, licensed under CC by 4.0. Neuroneurocutaneous syndromes, 5/9. Neurofibromatosis type 1. Multiple light brown macules with irregular borders, café au lait spots, are visible on the upper left arm, shoulder, and back. This presence of multiple café au lait spots is highly suggestive of neurofibromatosis type 1. Source: courtesy of Dr. Gary M. White MD. Neurocutaneous syndromes, 6/9. Neurofibromatosis type VV. Trunk of a 35-year-old female patient showing 4 brown café au lait spots as well as scattered papules and nodules. Neurofibroma. Source: copyright IMPP. Father-son. Lisk nodules VV. Right eyes of a father and son, multiple brown yellow, well-defined, and partly confluent papules, hamartomas, are visible on the iris. These lesions are called Lisk nodules and can be seen in the vast majority of individuals with neurofibromatosis. Source: copyright IMPP. Neuroneurocutaneous syndromes, 8/9. Lisk nodules. Right eye, multiple brown yellow, well-defined, and partly confluent papules, hamartomas, are visible on the iris. These lesions are called Lisk nodules and can be seen in the vast majority of individuals with neurofibromatosis I. Source: Lisk nodules by Demetrius Malamos, Wikimedia Commons, licensed under CC by 4.0. Neuroneurocutaneous syndromes, 9/9. Copyright. Overlay. Vestibular schwannomas and parasagittal meningioma VV. MRI head, T1 weighted, with contrast, A. Axial plane, B. Coronal plane, of a patient with neurofibromatosis type 2, NF2, the bilateral contrast-enhancing cerebellopontine angle masses, green overlay, represent vestibular schwannomas. The parasagittal location of the third intracranial mass, red overlay, suggests that it is a meningioma. Bilateral vestibular schwannomas are the hallmark feature of NF2. Many patients also develop meningiomas and other tumors of the central nervous system. Source: Figure 1 in Magnetic Resonance Findings of Neurofibromatosis Type 2, a case report by Gabriela Spielberg et al., Cases Journal, licensed under CC by 2.0. Neuroneurocutaneous syndromes, 6/7. Skin. Adenoma sebaceum ash leaf spots, 3 or more. Shagreen patch. Ungual fibroma. Clinical features of tuberous sclerosis. Copyright Boss. Tuberous sclerosis brain tumors, /adhemartoma giant cell astrocytoma seizures intellectual disability heart. T cardiac rhabdomyomas. Kidney renal angiomyolipoma renal cysts renal cell carcinoma. Overlay. Tuberous sclerosis CCT, axial view characteristic bilateral, subependymal, hyperdense calcified lesions, green area, adjacent to the lateral ventricles, white area. Additionally, there is a subcortical, cystic lesion in the right occipital region, shaded area. Source: Copyright IMPP. Neurocutaneous syndromes, 7/7. Overlay. Tuberous sclerosis CCT, axial view characteristic bilateral, subependymal, hyperdense calcified lesions, green area, adjacent to the lateral ventricles, white area. Additionally, there is a subcortical, cystic lesion in the right occipital region, shaded area. Source: Copyright IMPP. ACOLLINIUMM. Overlay. Large angiomyolipoma associated with tuberous sclerosis T2 weighted MRI of the abdomen with gadolinium-based contrast medium, frontal section, large angiomyolipoma of the left kidney, K, associated with tuberous sclerosis, L equals liver, S equals spleen, source: Copyright IMPP. Plus coli WEM. Copyright overlay. Large angiomyolipoma associated with tuberous sclerosis T2 weighted MRI of the abdomen with gadolinium-based contrast medium, frontal section, large angiomyolipoma of the left kidney, K, associated with tuberous sclerosis, L equals liver, S equals spleen, source: Copyright IMPP. And neurocutaneous syndromes, 4/7. Ungual fibromas. Multiple fleshy papular lesions are visible on this patient's nail beds, causing localized damage to the nail and impairing nail growth. This is a typical finding in tuberous sclerosis. Source: Figure 3, in Frequent Falls and Confusion, Recurrent Hypoglycemia in a Patient with Tuberous Sclerosis Complex by Alexander N. Kamenos, Lisa Yang, Ali Ibarra, Waljit Estilo, J.H. Duncan Bassett, Jeannie F. Todd, Clinical Case Reports, licensed under CC by 4.0. Neuroneurocutaneous syndromes, 3/7. Shagreen patch yen. Photograph of the back of a patient with tuberous sclerosis complex. A flesh-colored, irregularly shaped, slightly elevated patch can be seen on this patient's lumbosacral region. The fibrotic tissue gives it a bumpy appearance, which is often compared to that of orange peel. Source: Figure 1, in Brain Proteomic Profiling in Intractable Epilepsy Caused by TSC1 Truncating Mutations, a small sample study by Liu Yd, Ma My, Hu XB, Yan H, Zhang YK, Yang HX, Feng JH, Wang L, Zhang H, Zhang B, Li QB, Zhang JC and Kong QX, Frontiers in Neurology, licensed under CC by 4.0. Modifications, image is cropped. And neurocutaneous syndromes, 2/7. Copyright overlay. Ash leaf spots VV4 ellipsoid, hypopigmented macules, ash leaf spots, are located on the back of the patient, green overlay. The presence of more than 3 ash leaf spots is characteristic of tuberous sclerosis. Source, courtesy of Dr. Gary M. White MD. Neurocutaneous syndromes, 1/7. Adenoma sebaceum in patient with tuberous sclerosis VV. Multiple papules, resembling acne, can be seen on this patient's face. These findings are suggestive of adenoma sebaceum, a cutaneous condition in patients with tuberous sclerosis characterized by the presence of angiofibromas. Source, a case of tuberous sclerosis showing facial angiofibromas in characteristic butterfly pattern by Herbert L. Fred MD and Hendrik A. van Dijk, Wikimedia Commons, licensed under CC by SA 3.0. Overlay. Hemangioblastoma. Photomicrograph of a biopsy from a cerebellar mass, H&E stain, high magnification, numerous thin-walled small blood vessels, examples indicated by yellow overlay, containing red-stained erythrocytes are visible throughout the tumor. Surrounding the blood vessels large stromal cells, examples indicated by blue overlay, with pale intracytoplasmic lipid inclusions, so-called foamy cytoplasm, can be seen. This appearance is indicative of hemangioblastoma. The diagnosis was confirmed by immunohistochemistry. Source, Hemangioblastoma Histology He by Marvin 101, Wikimedia Commons, licensed under CC by SA 2.0. Overlay. Hemangioblastoma. Photomicrograph of a biopsy from a cerebellar mass, H&E stain, high magnification, numerous thin-walled small blood vessels, examples indicated by yellow overlay, containing red-stained erythrocytes are visible throughout the tumor. Surrounding the blood vessels large stromal cells, examples indicated by blue overlay, with pale intracytoplasmic lipid inclusions, so-called foamy cytoplasm, can be seen. This appearance is indicative of hemangioblastoma. The diagnosis was confirmed by immunohistochemistry. Source, Hemangioblastoma Histology He by Marvin 101, Wikimedia Commons, licensed under CC by SA 2.0. Neurocutaneous syndromes, 2/4. Retinal hemangioblastoma in von Hippel-Lindau disease. Fundus photography of a left eye adjacent nasally to the optic disc, a sharply demarcated orange lesion is visible. This is the typical appearance of a retinal hemangioblastoma. Approximate 50% of patients with a solitary lesion will have von Hippel-Lindau disease. The vast majority of patients with multiple lesions will have von Hippel-Lindau disease. By Shida Chen, Emily Y. Chu and Chi Chao Chan, Journal of Medical Case Reports, Biomed Central, licensed under CC by 4.0. Modifications, image cropped and removal of the letter B. Neurocutaneous syndromes, 3/4. Cerebellar hemangioblastoma VV. Source, Figure 1, in von Hippel-Lindau disease-associated hemangioblastomas are derived from embryologic multipotent cells by Derek M. Park, Zhengping Chuang, Ling Chen et.al., plus Medicine, licensed under CC by 2.5. Neurocutaneous syndromes, 4/4. Overlay. Hemangioblastomas of the central nervous system in von Hippel-Lindau syndrome VV. MRI images, contrast-enhanced, T1 weighted, of a patient with von Hippel-Lindau syndrome. Image A, brain, axial view, shows a tumor within the lateral aspect of the right cerebellum. It consists of an enhancing solid component, red overlay, and a larger, hypo-intense part representing a cystic component, blue overlay. Image B, brain, sagittal view, shows a contrast-enhancing tumor, green overlay, between medulla oblongata and cerebellum, within the region of the foramen of Magendie/median aperture. Image C, spine MRI, sagittal view, shows a hyper-intense tumor, yellow overlay, within the dorsal/posterior spinal canal at the level of vertebra C5-C6. Von Hippel-Lindau syndrome is a hereditary disorder characterized by the development of tumors in multiple parts of the body. This includes hemangioblastomas of the central nervous system, such as in this example. Hemangioblastomas are highly vascular tumors, resulting in the intense enhancement demonstrated on these post-contrast images. Peritumoral cysts are neurocutaneous syndromes, 4/4. Overlay. Hemangioblastomas of the central nervous system in von Hippel-Lindau syndrome VV. Image A, brain, axial view, shows a tumor within the lateral aspect of the right cerebellum. It consists of an enhancing solid component, red overlay, and a larger, hypo-intense part representing a cystic component, blue overlay. Image B, brain, sagittal view, shows a contrast-enhancing tumor, green overlay, between medulla oblongata and cerebellum, within the region of the foramen of Magendie/median aperture. Image C, spine MRI, sagittal view, shows a hyper-intense tumor, yellow overlay, within the dorsal/posterior spinal canal at the level of vertebra C5-C6. Von Hippel-Lindau syndrome is a hereditary disorder characterized by the development of tumors in multiple parts of the body. This includes hemangioblastomas of the central nervous system, such as in this example. Hemangioblastomas are highly vascular tumors, resulting in the intense enhancement demonstrated on these post-contrast images. Peritumoral cysts are common in these tumors, and result from plasma ultrainfiltrate passing through the permeable tumor blood vessels. Sturge-Weber syndrome. Definition: congenital, non-inherited vascular disorder caused by somatic mosaic mutation of GNAQ gene. Pathophysiology: mutation of GNAQ gene, abnormal embryonal developmental of neural crest derivatives, capillary malformations. Diagnosis: at MRI/CT scan, tram-track appearance of leptomeningeal calcifications at increased intraocular pressure. Treatment: symptomatic. Sturge-Weber syndrome fact sheet. Copyright Emboss. Glaucoma. Port wine stain, nevus flammeus. CNS. Leptomeningeal vascular malformations, leading to seizures may. Intellectual disability. Stroke-like episodes, example hemianopia, hemiparesis. Port wine stain, nevus flammeus. A sharply demarcated, irregularly configured, erythematous area with a smooth surface on the left side of this 2-month-old infant's face is visible. Image source of original image, www.pediatry-in-builder-n.de. Created by Dr. Thomas Rotten-Strock. Modifications to original image, anonymized. Overlay. Cerebral calcifications with atrophy, CT head, without contrast, axial plane, of a young child with Sturge-Weber syndrome. Extensive gyriform subcortical calcification of the left cerebral hemisphere is accompanied by left cerebral atrophy, with prominent sulci, exemplified by red line, and adjacent cerebrospinal fluid spaces, exemplified by green overlay. Source: axial non-contrast in Sturge-Weber syndrome by Frank Gaillard, Radiopedia, licensed under CC by SA 3.0. Overlay. Cerebral calcifications with atrophy, CT head, without contrast, axial plane, of a young child with Sturge-Weber syndrome. Extensive gyriform subcortical calcification of the left cerebral hemisphere is accompanied by left cerebral atrophy, with prominent sulci, exemplified by red line, and adjacent cerebrospinal fluid spaces, exemplified by green overlay. Source: Axial non-contrast in Sturge-Weber syndrome by Frank Gaillard, Radiopedia, licensed under CC by SA 3.0. Overlay. Sturge-Weber syndrome. MRI head, T1 weighted, with contrast, axial plane, of a patient with Sturge-Weber syndrome. Marked leptomeningeal contrast enhancement along the right parieto-occipital gyri and sulci can be seen, green overlay. Source: Figure 1df, in isolated leptomeningeal angiomatosis in the 6th decade of life, an adulthood variant of Sturge-Weber syndrome, type 3. Role of advanced magnetic resonance imaging and digital subtraction angiography in diagnosis by V. Muralidharan, G. Phyla, M. Travala et al., BMC, Neurology, licensed under CC by 4.0. Modifications: image cropped. Original image was made up of 6 images. Cf. arrows and asterisk removed. Copyright. Overlay. Sturge-Weber syndrome. MRI head, T1 weighted, with contrast, axial plane, of a patient with Sturge-Weber syndrome. Marked leptomeningeal contrast enhancement along the right parieto-occipital gyri and sulci can be seen, green overlay. Source: Figure 1df, in isolated leptomeningeal angiomatosis in the 6th decade of life, an adulthood variant of Sturge-Weber syndrome, type 3. Role of advanced magnetic resonance imaging and digital subtraction angiography in diagnosis by V. Muralidharan, G. Phyla, M. Travala et al., BMC, Neurology, licensed under CC by 4.0. Modifications: image cropped. Original image was made up of 6 images. Cf. arrows and asterisk removed. Neurocutaneous syndromes, 2/4. Ataxia telangiectasia VV. Medial angle of the left eye showing severely dilated blood vessels on the conjunctiva, conjunctival telangiectasia. Conjunctival telangiectasias are a clinical finding of ataxia telangiectasia, Lewis-Barr syndrome, a rare neurocutaneous syndrome. Source: Ataxia telangiectasia, National Eye Institute, Wikimedia Commons licensed under public domain. Neurocutaneous syndromes, 1/4. Ocular and cerebral manifestations in ataxia telangiectasia VV. Image A, close-up photograph of the left eye while the patient is looking to the right. Top: a significantly dilated vessel of the conjunctiva can be seen. Apart from that, the prominent epicanthic fold suggests an Asian background of the patient. Image B, cranial MRI, T1W, sagittal view, a remarkable atrophy of the cerebellum can be noted, leading to secondary enlargement of the cerebrospinal fluid system. When put together, both findings are characteristics of neurocutaneous syndrome ataxia telangiectasia, Lewis-Barr syndrome. Source: Figure 1, the clinical features of an ET patient by Zhao Chen, Wei Ye, Zhelong et al., +1, licensed under CC by 4.0. Neurocutaneous syn. Telangiectasia VV. Small dilated blood vessels with a thread-like appearance are visible. This is the typical appearance of telangiectasia. Source: Telangiectasia by Klaus D. Peter, Wikimedia Commons, licensed under CC by 3.0. Neurocutaneous syndromes, 4/4. Spider angioma VV. A telangiectasia characterized by a vascular arcade branching out from a central arteriolar point. Spider angiomas can arise during childhood or pregnancy as well as in patients with liver disease or thyrotoxicosis.